Good afternoon. Okay, good afternoon to each and everyone. We shall continue our presentation of the seminar paper output for our candidates for Master in Management. So we have witnessed the presentation of the MPA, Master in Public Administration, and the cluster on the Master on Public Health Administration this morning. So we would like to thank Professor Gadia is extending his congratulations again to the graduating class of MMHoA Group. So we're happy that this afternoon we shall have the last two groups or cluster to present their outputs. We shall introduce them shortly. With that, each participant, the students of MMHoA Group shall receive an e-certificate, which I have cascaded yesterday. And there is another e-certificate that will be given this afternoon for our second day. So there is an equivalent hours if you need that, especially with industries. They need an indicated number of hours of engagement. And to all the presenters, we have a certificate also of recognition for your participation, especially presenting your output. So we will recognize you later on. So at this point, may I call on the professor for the group Master in Management, Major in Hospital Administration, MMHoA, Dr. Enrico S. Santos, to introduce the presenters and to be followed by their presentation. Good afternoon, Doc Endex.
Thank you, Doc Matt. At this point, let me introduce the thesis/project output of the candidate for the program in Master in Hospital Administration. Okay, please. Doc, I have a query. Every 5 presenter Q&A or at the end of the presentation of the group?
We'll just have a cumulative after the all presentations.
All presentations.
Yeah.
Okay. You can type your question on the chat box. Okay. To present his title, Assessment of Perception of Patient and Doctor on the Use of Telecommunication for Infected Wound During the COVID Pandemic, a Pilot Study, let me call on Dr. Paulino Alonso, a Master in Management, Major in Hospital
Good day.
Administration.
I'm Ismael.
Go ahead.
Paulino F. Alonso. And I finished Doctor of Medicine at the MCU, FDT, MF, and underwent general surgery training at the Veterans Memorial Medical Center. And presently, I'm working at the National Center for Mental Health in Mandaluyong. My study is perception of patients and doctors on the use of teleconsultations for infected wounds during the COVID pandemic, pilot study. The research objectives is to assess the perception of both patients and doctors on the practice of teleconsultations for infected wounds during this COVID-19 pandemic. Introduction. The spread of the COVID-19 pandemic has profoundly affected how we conduct our medical practice, resulting in a decrease in necessary medical care, including the wound healing specialty. The actual period of COVID-19 pandemic limits the ability to practice wound healing in normal conditions. During this time of the COVID pandemic, the Philippine healthcare needs to adjust for the immediate diagnosis and management of infected wounds through telemedicine. Early diagnosis and prompt management of these infections through telemedicine are essential to be implemented in our communities. Given that at time, patients may not be able to travel to hospitals, clinics, or the doctor's office, telemedicine can be a convenient option in making sure that the patient still receive the quality care they need. So related literature, teleconsultation as a practice. In a study by Bratton and Cody, approximately all the patients in a primary health care telemedicine center reported a positive impact on doctor-patient relationship. Another study conducted by Greenwood et al. Showed that telemedicine earned high scores even through rural patients, recognized telemedicine as one-off compared to face-to-face meets. But they are grateful for not having to travel long distance for consultations. In a study by Collins et al., a few percent of the patients were not comfortable facing the camera or directly interacting with the provider. But Collins found no distinct difference between the telemedicine group and the traditional group when questioned about the overall care. Teleconsultation cost effectiveness. In a study conducted by Dick et al., 71% of patients responded with high scores of the pediatric telemedicine consultations, with cost savings of more than $1,000 per patient. The study showed that using telemedicine in rural areas, doctors can help medicine as it reduces travel time, cost, and decrease the needs to take time off work for patients. Barriers to teleconsultations. Barriers reported in Saudi Arabia study were the lack of basic knowledge and benefits of telemedicine, which is 49%, difficulty in application, 29%, and the lack of time to adopt telemedicine, 22%. Methodology. The research design is a descriptive pilot questionnaire study conducted in the researchers' consultation clinics. The study was conducted in two phases. The first was a separate questionnaire for medical doctors involved in the teleconsultation. The second phase was questions for researchers' patients who teleconsulted for an infected wound. The questions were close-ended, self-designed, and developed by Dr. Rayesh Acharya from a similar pilot study, evaluation of patients and doctors' perception towards the use of telemedicine. The questionnaire consists of 13 questions pertaining to specialist perceptions and 9 questions concerning patients' perspective on satisfaction with the quality of service, economical feasibility in telemedicine, and problems related to it. The statistical analysis. Data generated from the study were coded and inputted into the computer system and analyzed using SPSS program, descriptive study analysis. Data were analyzed in terms of frequency percentages and parametric statistics, like a mean and standard deviation. Qualitative data obtained from the respondents through the interview was also utilized to get the complete picture of teleconsultation process and challenges. Results. Perception of expertise in teleconsultation. Approximately 93% of the participants were pleased with the teleconsultations provided, and all the respondents said that they would suggest this medium to their relatives and friends. 83% of the patients respondents acknowledged that they did not have a problem in understanding the usage of teleconsultation. So, teleconsultation's cost effectiveness. 88% of patients said that the procedure was both practical and convenient. 7% thought that teleconsultation therapy was expensive, but convenient for them. And 4% of participants felt that it was economical, but not convenient. Problems encountered in teleconsultations. Issues encountered through teleconsultations by patients were 31 technical issues. 48 were not happy with the care offered, the main problem of which was not comfortable facing the camera and lack of face-to-face interaction with the doctor. During the consultations, doctors were faced with technical issues, around 30%, time scheduled 80%, and 50% had not contact lapse problems. A respondent had issues with teleconsultations because the wound took a long time to heal, but eventually healed after 3 weeks. This study revealed that all doctors and 88% of patients included in the study were pleased and satisfied of their teleconsultation experience. To conclude, patients and specialist doctors are very satisfied with teleconsultation in diagnosing and treating infected wounds, especially during this COVID-19 pandemic. As a recommendation, further studies should be conducted in a larger population, longer duration, and on different diseases and specialties. It is to help and guide in implementing an improvement of telemedicine process in certain diseases in our Philippine setup. Thank you.
Thank you.
Thank you, Dr. Ismael Paulino Alonso. The next presenter with this title, Impact of the Novel Coronavirus 2019 Pandemic on ENTHNS Patient and Volume in Local District Hospital in Manila. The proponent, Dr. Fatima Angela Pumali Basilio, MD.
Good day. I am Fatima Angela C. Umali Basilio, and I will present the study, The Impact of the Novel Coronavirus 2019 Pandemic on ENTHNS Patient Volume in a Local District Hospital in Manila. The novel coronavirus 2019 is a respiratory disease first identified in Wuhan, China, that spread to its neighboring countries and was declared a pandemic on March 11, 2020. To control its spread in the Philippines, quarantines and lockdowns were imposed. Hospitals remained open, but there was suspension of OPD consultations and procedures. The aim of this study is to assess the impact of the COVID-19 pandemic on the ENTHNS patient volume in a local district hospital in Manila. The dramatic change in the number of patients bring about negative effect to the patients, specialists, and the hospital. By acknowledging the new normal setup, simple yet attainable solutions can be suggested for a timely management of the situation. This is a descriptive comparative analysis of the total number of ENT patients who consulted from March 2019 to February 2020, a year before the pandemic, and from March 2020 to February 2021, a year during the pandemic. The overall number of patients, distribution per subspecialty, and tally of the procedures were compared. Percent decreases in all of these aspects were analyzed. A total of 4,729 patients consulted a year pre-pandemic, while only 753 patients were seen during the pandemic. There was an 84% decrease in the number of patients seen. This was due to the suspension of OPD to limit the transmission of infection. It was noted that all ENT subspecialties showed decrease in consultations. The greatest decrease in consultation was seen in the oral cavity because most concerns were thought to be associated symptoms of COVID-19. Therefore, patients were immediately triaged to the COVID area and not decked to the ENT. The maxillofacial trauma has the least decrease in consultations, meaning cases of physical injuries were still prevalent even during the pandemic. ENT procedures like major surgeries and endoscopies both showed percent decrease during the pandemic as illustrated in Table 3. Suspension was done since these procedures were highly aerosol-generating procedures that can easily spread infectious aerosol particles to the surroundings. The current decrease in the volume of patient can result to imminent surge in consultations in the coming months or years. It can also lead to a delay in diagnosis and treatment that may cause progression of diseases of the patients. Reopening of the OPD and resuming the procedures may put the ENT specialist at increased risk of contracting the virus, but can be prevented by donning a complete level 4 PPE with provision of a negative pressure booth. These suggested solutions can gradually resume the physical consultations, and it is imperative that one's creativity be used to adapt to the new normal. Thank you.
Thank you.
Thank you, Dr. Fatima Angela Umali Basilio. The next presenter with with their title, Blockchain Technology as Applied Patient Health Record in Private Medical Center and DOH retained medical center. To present their title, let me call on Dr. Alex Kabungkal and Dr. Emily Kabungkal.
Good day. We are presenting to you our project paper entitled Blockchain Technology as Applied in Patient Health Record in Private Medical Center and DOH Retained Medical Center. This paper aims to provide solutions on how to preserve, store, and safely secure the patient's medical records using the blockchain technology in private medical centers as well as DOH-retained medical centers as they accumulate throughout the years and make them readily available to authorized entities as needed. Blockchain technology was first used in 1991 by a group of researchers to timestamp digital documents so that it cannot be backdated or tampered with. It was later adapted by a person or a group hiding under the name Satoshi Nakamoto in 2009 to create a digital cryptocurrency called Bitcoin. A blockchain is a chain of blocks that contain information in the form of a distributed ledger that is completely open to anyone but whose stored data is difficult to change once it is recorded in the block. Blockchain technology has been recently applied in healthcare systems. This blockchain-based model gives the healthcare system a safe, secure data integrity while developing standardized and formalized contracts for accessing the data. It guarantees transparency and especially immutability, which are essential for secure management and storage. Gathering of data will start with questionnaires addressed to different stakeholders, namely IT department, record section, physician, pharmacist, laboratory technicians, radiology technicians, nurses, physical occupational respiratory therapists, and patients. The data will be assessed to identify the present problems that each stakeholder encounters regarding the medical record and provides possible solutions to these obstacles using the blockchain technology. It will also determine whether these stakeholders are willing to shift to electronic data regarding the medical record.
A blockchain software system is established by the IT department of the private medical center as well as the DOH retained medical center. These departments will also develop the electronic health record for each patient seen on either medical center. This is how the process works. Minimum investment for this project includes the following: a complete computer workstation, a server for all, the electronic medical record or the hospital information system, the training of personnel, and internet subscription. Blockchain technology, if used in medical records, will ensure that the data collected are safe, secure, and readily accessible anytime. Interoperability is seamless as long as a standard format is followed. The blockchain technology can be adapted in the healthcare systems of both private medical centers and DOH-retained hospitals. And once a proper infrastructure is in place, both the private medical centers and DOH-retained medical centers can have access to the same or particular medical record. And lastly, voluminous medical records that the patients usually carry around, as well as missing data from their medical records, will be a thing of the past. Thank you for listening to our presentation. This is Alexander Kabungkal
And Emily Kabungkal at your service. We hope that our project paper will provide inspiration in your future researches. Thank you.
Thank you so much. Okay, next please, Doc Index.
Thank you, Dr. Kabungkal. Then the next presenter presenting his title, Technological Administration on Medical Online Consultation at ENT Outpatient Department of Bulacan Medical Center. Dr. Paulo Angelo DC Katindig.
Good day, everyone. I am Dr. Paulo Angelo Katindig, and I'll be discussing my project paper entitled Technological Administration for Medical Online Consultation at ENT Outpatient Department of Bulacan Medical Center. Since the beginning of the COVID-19 pandemic, social distancing and overcrowding is being avoided. Though fairly new in our country, medical online consultation opened a venue for medical practitioners to see patients without face-to-face contact. as part of Bulacan Medical Center, which is a tertiary hospital located at Malolos, Bulacan with almost a 300-bed capacity. The institution is the referral hospital of all government hospitals for the whole province of Bulacan, catering for both in and outpatient care. This made me realize to investigate the capacity and the capability of our patients to try medical online consultation, in particular my ENT patients at the outpatient department. So the main objective of my paper is to know the capacity and capability of ENT outpatients of Bulacan Medical Center to utilize medical online consultations. The methodology used is that 80 ENT outpatients were randomly selected and questionnaires with close-ended demographic and internet usage were distributed. All data were analyzed using the SPSS IBM descriptive analysis. For my review of literature, the internet supports a shift towards more patient-centered care, enabling consumers to gather health-related information themselves. This would allow them to communicate with their healthcare providers, health plan administrators, and other consumers electronically, and of course, to receive care in their own home. Online consultations offer potential benefits to patients, especially that they are spared for the price and inconvenience of travel. It can also allow care providers to consult with each other electronically to discuss treatment plans or operative procedures at their own homes. But fears are also expressed that they may be clinically risky and are less acceptable to patients and of course to the employees, and that they may bring significant technical, logistics, and restrictive challenges. There are several factors to contemplate when starting consultations via the internet, such as patient's technological capability, internet power, logistics, patient's privacy, medical records, technological system of the healthcare provider, to name a few. In a randomized clinical study done in UK last 2014, no significant difference to video visits were assessed as equivalent in efficiency to conventional outpatient visits. These are measured by the amount of time spent face-to-face, patient waiting time, and total time devoted to care. There were no significant difference in patient perception of visit confidentiality, efficiency, education, quality, and overall satisfaction. Thus, video visits incurred lower cost and were associated with similar levels of satisfaction compared to conventional outpatient visits. However, a different story is there in developing countries like the Philippines. Much less effort has been spent for similar initiatives in developing countries, probably due to possible small returns of investment, limited budget, and to the greater difficulty expected or encountered due to the lack of technological infrastructures. Nevertheless, online medical consultation in developing countries could be a leverage to provide wide populations with basic healthcare services and to close the distance between rural areas and specialized hospitals usually located in big cities. Still, efficiency, acceptability, and cost-effectiveness of medical online consultations compared to conventional healthcare are still needed to be studied and evaluated. For my results and discussions, around 60% of my subjects have gadgets with internet that can be used for online consultation. On a study conducted this 2020, around 74 million Filipinos have smartphones at hand, and majority are from urban areas, in particular in Metro Manila. Also, they have internet access, which accounts for almost half of the Filipino population. Upon asking the internet users if they have tried online consultations, only 1% of the subjects have tried it via Facebook. Also asking if given the opportunity to try medical online consultations, 29% agreed to yes and 71% is no. For those who agreed to try it online, their main reason is because of their far distance to the hospital, followed by their feeling of safety from acquiring communicable diseases like COVID and less waiting time. While for those who do not want to try online medical consultations, reasons are: 1 is that they have slow and unstable internet connections at home. 2, they can ask more about their disease, pointing out more of their sickness, and like the feeling of personal connection with their doctor. And lastly is the incompetence of usage of computer, Facebook, and other social media. Currently, There are no statistics available on the use of online medical consultations here in the Philippines. This is just becoming a new norm due to the recent effect of the COVID-19 pandemic. Several platforms of online consultations has been available for public use such as SiriusMD, Medify, Consulta MD, Natrafarm HIP program, and more. These are all free downloadable programs that patients can easily access and book an appointment with their medical consultation. However, this would require a fast, stable internet connection and a smartphone to fully enjoy a hassle-free consult. So for my conclusion, online medical consultation is a good alternative to in-clinic visitations for the patient, in particularly this pandemic. This would decrease the time for traveling for patients coming from far-flung areas, decrease the chance of contracting communicable diseases in the hospital environment, and saves time for a long lineup with easy and convenient access in their own household. The downside is the possibility of breach of security and limited physical examination of the doctor. There are many things also that needs to be considered for online consultations to be beneficial for both users and doctors, such as internet speed, computer or smartphone availability, users' competence to use the computer, platforms to be used for online medical consultation, and price for the consult to cover for its maintenance. In the Bulacan Medical Center ENT OPD clinic, though majority of the patients have gadgets and internet connection for their online medical consult use, still many are hesitant to try this method and still wanted the traditional way of patient-doctor consultations. Patient education on the use of these online consultations and immersing them to try by free online consultation is another way to test if this method may be appealed to the public. This in an initial study to determine the patient's acceptance and capability to online medical consultation. Further studies are needed to determine the factors on why they don't want to try it and determine the factors that can convince the public to try it. Another recommendation is to do a study on the part of the hospital to determine the acceptability, capability of its system to deliver online medical consultation. That ends my study. Thank you very much for listening.
Thank you. Thank you so
Thank
much.
you, Dr. Paulo Angelo Katindig. The next presenter with her title, The Prevalence of Hesitance, Parent in COVID-19 Vaccine in Children ages 7 to 18 years old. Miss Leia Sardena.
Good afternoon. I will be presenting the prevalence of hesitant parents in COVID-19 vaccine in children ages 5 to 18 years old. So, thesis statement. The aims of this research are to raise the awareness of both parents and children about the benefits of COVID-19 vaccine and also to highlight the feeling of hesitation about the vaccine so that the proper implementation of education will be applied, especially in the remote area. So, brief overview of literature. They are using their own strategies in parenting in taking care of their children than depending on the COVID-19 vaccine. According to WHO 2019, despite the proven efficacy of vaccine, significant portion of the world's populations still hesitate to get the vaccine. A review of resources has identified a clear needs for target tools and support to help clinicians identify common sources of types of hesitancy and to effectively address patient concerns with the ultimate goals of increasing vaccine uptake. Next, An additional 25% of parents surveyed said that they would get their children vaccinated, but not right away. Many indicated they were simply unlikely to trust the vaccine until it has been in circulation of several months. Next, in their report on vaccine hesitancy, identified three broad categories of parents concerned regarding childhood vaccine. Number one, the necessity of the vaccine. Number two, vaccine safety. Number three, freedom of choice. This overview describes this category of concern with regards to the future COVID-19 vaccine and present suggestion to enhance the likelihood of rapid, widespread of vaccine uptake in United States. So brief description of research. In methodology, this research is a quantitative research. Methods emphasize objective measurement and the statistical, mathematical, and numerical analysis of data collected through questionnaires and survey. Quantitative research focuses on gathering numerical data and generalizing it across the group of people or explain particular phenomena. So, quantitative phenomenological approach is adopted in this paper. The study participants were 30 individuals. Most of them are parents in cities and remote areas. And because of the movement of restriction imposed by the current pandemic, I conduct the study both offline and online. These narratives were simply structured. Interviews were transcribed using voice message and recording analysis with the use of field notes and ensure the trustworthiness of the data. The team were operated, autonomy and confidentiality were strictly imposed throughout the study. So this pie graph shows one of the questions that I put in the survey form. Which of the following is helpful if you did not decide yet? If you did not decide yet for the vaccine. So 11.5% got a if the doctor would approve. And the 30.8% is I want it to be a period on how other people react to the vaccine. And the highest percentage is 50%. If the detailed written review will share the topic about how the vaccine produced and what it will contain. Next question is, do you agree for the COVID-19 vaccine for your children? 4% said, I want to wait for the other country, what is the effect of the vaccine for their children? And 32% said yes. And the one who got highest is no answer, which is 86%. So this pie graph shows that which of the following defines your concern about getting the vaccine. The pie graph shows or define the concern of the respondents regarding taking the vaccine or not. It shows that the concern about the side effects, long-term safety, and efficacy got the highest percentage of 50, while the second, the highest got 46.2%, and they don't believe that it will be a solution for coronavirus. And 3.8 is concerned with the safety of children, and the other has no vote. So this one, the respondents is only 26 people. Out of 30 people, 26 only answered. So in conclusion, as parents' intention to vaccinate their children in suboptimal, further communication of COVID-19 vaccine safety in the source of information was associated with increased acceptance of children's COVID-19 vaccination. Therefore, local healthcare authorities should intensify their campaigns targeting hesitant parents to increase vaccine uptake in children is warranted. The main reason for not intending to vaccinate their children were the inadequate of information about the safety of the COVID-19 vaccine and worry about the potential side effects. These findings call the further communication about the safety and targeting of the younger parents as they were less likely to vaccinate their children with COVID-19 vaccine, relying on National Official Healthcare Authority. So this ends my presentation. So while doing this research, I just want to share that that time there is no vaccination for children, but now there is an ongoing vaccine for the children now. I choose this topic personally because I am a pediatric nurse, and also I want also to help especially the children who are facing the most difficult part today in pandemic time because of online class. They are not able to go to school because our children don't have the vaccine. And good thing now we are starting to have this vaccine. That's why I choose this personally. So that ends my presentation. Thank you very much.
Thank you, Leia
Thank you.
Sardena. The next presenter with her title, COVID-19 Vaccination, Acceptability and Perception Among Healthcare Workers and Essential Frontliners in Community in Cavite. Dr. Josefa Andrea Cornesta.
Good day to everyone. I am Josefa Andrea Cornesta. I will be presenting on a project paper on COVID-19 vaccination, acceptability and perception among Filipino healthcare workers and essential frontline workers in a community in Cavite City. The 2019 novel coronavirus is a new strain of coronavirus that has not been previously identified in humans. It was first discovered last 31 December 2019. The human case of pneumonia of unknown etiology was reported in Wuhan City, China. A coronavirus named 2019 nCoV acute respiratory disease was identified as a positive agent by Chinese authorities on the 7th of January 2020. Since then, human cases with travel history to Wuhan have been reported by several provinces in China and by a number of countries outside China. COVID-19 was declared by the WHO as a public health emergency of international concern last 30 January 2020. The first confirmed case in the Philippines was in Metro Manila, a 38-year-old Chinese woman who was confirmed positive and confined in San Lazaro Hospital in Manila. The second case confirmed was on 02 February 2020, who is a 44-year-old Chinese man who died a day after a confirmed positive result outside mainland China. By February 12, 2020, the WHO announced that the novel coronavirus was officially called coronavirus disease 19. It was then declared a pandemic on the 11th of March 2020 by the WHO and became a major public crisis, affecting the countries as well as the Philippines. On 08 May 2021, there are a total of 1,094,849 cases and 18,269 died from coronavirus 19. Most cases were found in NCR and Region 4A. There are 5 variants of concern defined as a particular version of this virus that has a specific combination across its genome when it started to increase in frequency over the population for a period of time. The WHO global variants of concerns are the following: the United Kingdom variant, the South African variant, the Gamma or Brazil variant, the India variant, and the latest variant, which is the Delta variant. Most people are being infected from other people when in close contact within 2 meters or 6 feet distance. It spreads through the droplets and created when we talk, cough, sing, sneeze, or even breathe heavily. These droplets enter the nose, eyes, or mouth when the infected droplets are inhaled. Indoor spaces with inadequate ventilation, the virus can spread more easily. The same as touching of contaminated objects, even if you touch your face of infected people with or without symptoms can spread the virus. There are no specific treatment for COVID-19, but there are some medicines that might have shown benefits that are being evaluated further. Mild symptoms can be treated and be managed at home or at facility quarantine, while for severe symptoms, hospital management is required. Because the symptoms are almost similar to other illnesses, the definitive diagnostic test recommended is the RT-PCR swab test. While waiting for the result, it is recommended to isolate yourself. In many countries that have started a COVID-19 vaccination for adults aged 18 and above, the Philippine government received its first batch of COVID-19 vaccine last March 1, 2021, shortly after the arrival of 600,000 doses of Sinovac vaccine in response to the ongoing COVID-19 pandemic. The first healthcare worker who officially received the first dose of corona vaccine in our country was developed as a China-based Sinovac BioNTech, the Philippine General Hospital Director, Dr. Gerardo Legaspi. It was then followed by AstraZeneca Oxford University vaccine. A total of 44,000 vaccine doses against COVID-19 has been administered in just 2 months. The purpose of the study was to gain insight and assess the respondents on the factors affecting vaccination compliance on COVID-19 vaccination project. The study will use as data from a survey conducted on the acceptability of COVID-19 vaccine among government healthcare workers and essential frontliners in the Philippines. The study will recruit a participant from self-reported questionnaire using a Google Forms that are distributed electronically through email. The target population was individual aged 18 and above and currently living in a municipality of Cavite City. Included in the study are the healthcare workers and essential frontline workers. Using an online informed consent that will be obtained from all participants before proceeding with the questionnaire. The informed consent provided 2 options. Yes for those who volunteer to participate in the study and no for those who do not wish to. Only those who are selected with affirmative response were taken the questionnaire from page 2 to complete the survey. The respondents were clearly informed about the study's aim and objectives and were also advised that they were free to withdraw from the study at any time, without giving a reason, and that all information and opinion provided by anonymously and confidential. The study tool to be provided by the participants are in 2 languages, English and Tagalog. The majority of the questions will be answered by checking the appropriate choices from strongly agree to strongly disagree. The online approach is currently being used in order to avoid the physical contact as it might pose a risk on spreading the COVID infection. The first part will cover the social demographic information of each of the participants, including the age, gender, marital status, educational background, and occupation. And the second part will be the questionnaire on the COVID-19 vaccination acceptance, which will be assessed through questions with optional choices to choose from. The healthcare workers are a reliable source of information on vaccination to patients and their acceptance of COVID-19 vaccines, and it may influence the general population. Healthcare workers play an important role in immunization program success and research, as shown of their knowledge and attitudes in relation to vaccine determination and intention for vaccine uptake and recommendation of the vaccine. People more commonly rely on the healthcare workers' information and actions to guide their decisions and have a successful preventive measures through vaccination, which has proved its capability to stop infection and save lives over the years. To further stop the spread of death and associated COVID-19 infection, the Philippine government is collaborating with WHO to acquire safe and effective vaccines for mass vaccination to gain herd immunity. The strategy to reinforce confidence in COVID-19 vaccination is to build trust to be able to share clear, complete, and accurate information on vaccine, vaccinators, and the national government. Second is to promote confidence among healthcare personnel in their decision to get vaccinated and recommended it to their patients, friends, and relatives. Engaging in a local and national profession association, health system, and other healthcare professionals in the LGU by strengthening the capacity of the healthcare professionals to be empathetic on the program of the COVID-19 vaccine. Host a discussion to promote safety of vaccines by sharing and answering concerns of vaccines available in the Philippines. Highlights on the experiences of some of the people who are initially hesitant to get vaccinated but later on made the decision to be vaccinated. Encourage our senior leaders and known personalities to be part of the vaccine champion. You can help stop the COVID-19 pandemic by getting COVID-19 vaccine. They are safe and effective. Plus, they are also free. That ends my presentation. Thank you.
Thank you, Dr. Josef Andrea Cornista. The next presenter with her title, Developing a Sustainability Program at Qualimed Hospital Santa Rosa through Safe Healthcare, Waste Management, and Energy Efficient Initiative. May I call on Dr. Katrina Diaz.
Good afternoon, everyone. I'm Dr. Katrina Diaz, and I will be presenting my project entitled Developing a Sustainability Program at Qualimed Hospital Santa Rosa through Safe Healthcare, Waste Management, and Energy Efficiency Initiative. In general, hospitals and healthcare facilities generate significant environmental footprint. Previous studies have shown the environmental impact of medical wastes and carbon emissions from hospitals. In recent years, there has been a global trend to adopt a green environment initiative. Qualimed Hospital, located at Santa Rosa, Laguna, is a 102-bed general hospital which at present is beset with these challenges: rising operational costs, increased medical wastes, increased utilization of community resources such as energy and water. One overlooked opportunity that can offer solution to these problems is sustainability. The goal of this project is to develop a sustainability program through Safe Healthcare, Waste Management, and Energy Efficiency Initiative. To execute it, the quality improvement methodology will be employed with the tool Plan, Do, Study, Act cycle. As part of the plan, baseline data on Qualimed Santa Rosa's hazardous waste generated and energy consumption was obtained. Shown here is the sustainability program on healthcare waste management, highlighting the consideration of having an on-site waste treatment with a microwave technology. Shown here is the sustainability program on energy efficiency initiative, highlighting the purchase of clean and renewable energy using solar panels. The impact of the program will be studied through statistical analysis. Then it will be implemented accordingly. The endpoint of this project will be the development of a sustainability program in Qualimed Santa Rosa Hospital which will focus on the creation of a strategic waste management system and energy efficiency initiative. This can be a basis for recommending best practices in hospital sustainability in the region. These are my references. Thank you for your kind attention.
Thank you, Dr. Katrina Diaz. The next presenter with her title, Efficacy on Online Consultation for ENT Patient in a Primary Healthcare Clinic in Makati, a Descriptive Analysis. May I call on Dr. Mitzi Cabe Domingo.
Hi, good day. I am Dr. Mitzi Cabe Domingo, and my presentation is on the efficacy of online consultations for ENT patients in a primary care clinic in Makati, a descriptive analysis. Advances in medicine have rewritten the script in preventing and treating diseases. These advances have had transformative results for health, medicine, and the society. Some of the most important advances are in the areas of digital technology. With the current pandemic, there have been many adjustments and changes in the medical field wherein there have been shifts away from the clinic and healthcare is now delivered in new settings such as the home or wherever the patient may be at a time when medical assistance is needed. This emerging approach in the Philippines is online medical consultations. The objective of this study is to determine the efficacy of online ENT consultations for patients. The specific objectives are as follows. Are the patients willing to do online consultations? And what are the advantages and disadvantages of doing online consultations? For the methodology, 100 ENT outpatients were randomly selected and were given close-ended questionnaires following a rating system of 1 to 5, with 5 being the highest and 1 as the lowest. The results showed that 58% of the respondents were female, with 43% of them being willing to do online consultations. 43% were aged 36 to 55 years old, 88% of whom were willing to do online consultations. 11% of the respondents were more than 75 years old, and only 3 were willing to do teleconsultation. In booking for appointments, 48% considered it to be easy and 2 found it very difficult. In addressing ENT medical concerns, 29% considered the experience very satisfactory, while 11% found that it was poorly addressed. 48% are willing to do follow-up online consultations again, and 3% said it wasn't likely, and for the overall satisfaction, 55% found it satisfactory and 11% found it to be a poor experience. 39% of the respondents were advised that they needed actual physical examination. 32% were advised to arrange for face-to-face clinic visits. 73% were satisfied with the teleconsultation, and 33% had communication difficulties. The results as shown reflects the different experiences patients had with their ENT online consultations. There was not much gender discrepancy in how willing they were to opt for virtual ENT consultations. Majority of the respondents that engaged in telemedicine may reflect the experience or know-how in using technology for such activities. The advantages versus the disadvantages. The benefits of teleconsultation are as follows. It's best used for routine or simple cases. It cuts down on the patient's waiting time. It provides easier access to healthcare and also provides less travel time and cost for both the physician and the patients. On the other hand, the disadvantages are the following. The eventual need of the patient for face-to-face clinic visits, the difficulty in making diagnosis in part of the physician due to lack of physical examination, the lack of knowledge and use of online platforms, communication difficulties, and its inapplicability to certain medical fields which are highly dependent on physical examination. With the many transformative changes that will take place in health and medicine, these approaches of new techniques will inevitably have risks. However, much effort should be put into maximizing the benefits and mitigate the risks. This new normal in healthcare is going to stay with us and further evolve as the medical need of the society will continue to grow as well. For the recommendations, a user-friendly platform should be available for teleconsultation. Data protection and privacy must be ensured. The patients should be informed of possible need eventually for face-to-face clinic visits prior to the teleconsultation proper. And in the field of ENT, a clinic setup may include electronic otoscopes for better visualizations. The following are the references used in this study. Thank you very much.
Thank you, Dr. Mitzi Cabe Domingo. The next presenter with the title Perception of Surgeon in Cardinal Santos Medical Center regarding telemedicine during the COVID-19 pandemic, Dr. Domle Dave Encarnacion. Domil Dave Encarnacion.
Good day, everyone. I am Dr. Donald Davis Encarnacion, and I'll be presenting my paper on the perceptions of surgeons in Cardinal Santos Medical Center regarding telemedicine during COVID-19 pandemic. So, as an introduction, we all know that the entire world is currently plagued by COVID-19, which has not only infected millions, but it has caused over 1 million deaths already. It is caused by a coronavirus, which spreads mainly through air when people are near each other, or when an infected person breathes, coughs, sneezes, or speaks, and it enters another person via their mouth, nose, or ears. It can likewise spread through contaminated surfaces. Knowing this mode of transmission and infection of COVID-19, it has been advised to do social distancing and as much as possible to decrease person-to-person interaction. Thus, those in healthcare industry are continuously at risk of being infected. Now, knowing this, we should know the alternative way of safely catering to patients and or providing healthcare services. And this is where telemedicine comes in and could be an answer to this dilemma. So, just a definition. Telemedicine refers to the practice of caring for patients remotely when the provider and patient are not physically present with each other. And usually, the use of information and communication technology to provide healthcare services to individuals who are at a distance from their healthcare provider. And a subcategory of this telemedicine is via teleconsult, whereby the consultation of the patient and interaction with their physicians is through video calls, either via their computers or cell phones, using the currently available software applications such as Viber, Zoom, and several others. And in the current scenario, with the improvement of technology, physicians and patients are able to interact and share information through the computer screen or even while on mobile via cell phone. But as with any technology or any new innovations, telemedicine included, it should be assessed if it is effective in comparison to what is currently being offered. This concept of telemedicine and telehealth is still new to some providers, patients, and even in the physicians, particularly the older age group. Thus, it is important to educate clinicians on this technology and its limitations. It is during this COVID-19 pandemic that telemedicine has really taken off or is becoming widely accepted since the implementation of the need for social distancing and as much as possible limitation of personal physical interactions. So for the methodology of my paper, it's a cross-sectional survey in which participants are the currently practicing surgeons in Cardinal Santos Medical Center, The sample will be convenient sampling, and invitation and consent to participate in the study will be given to each of the surgeons. After which, a demographic formation will be taken, and a questionnaire by a Likert scale, 1 being strongly agree and 5 being strongly disagree, will be used. And this survey will run from August 1 to August 31 of 2021, after which a descriptive statistics will be used, and SPSS software will be the tool used to get those statistics. As for the discussion, as we all know, the field of medicine is constantly evolving with new innovations in different fields, and in the form of new technologies, which, like any new system or instruments, there are always factors which hinder the acceptance and adoption of these new technologies. Factors such as the user's knowledge and perception of that new technology, as well as the comfort level of the user and general health literacy. So, going to the telemedicine, one advantage is that it can be a good medium for shared decision making among different clinicians and patients, and at the same time, it will be involved in the shared decision making. And as the world is trying to cope up with the COVID-19 pandemic, we would continue to see a rise in the utilization of this telemedicine service among different healthcare organizations and practitioners, with improvements and refinements along the way. Thank you.
Thank you, Dr. Tom, Dave, Encarnacion. The next presenter, with her title, The Influence of Leader Empowering Behavior and Work Conditions, the Nurses Burnout in Private Hospital in the City of Puerto Princesa. Dr. Joanna Fabelio Flores.
Good afternoon. I'm Dr. Joanna Fabelio Flores, presenting to you my project paper proposal entitled The Influence of Leader Empowering Behavior and Work Conditions to Nurses Burnout in a Private Hospital in the City of Puerto Princesa. Nurses are a critical part of healthcare and make up the largest section, accounting to 59% of the health profession. In the Philippines, there has been shortages of nurses because of migration despite the pandemic. Turnover rate was 17% for staff nurses, with half of this resulting from nurse migration overseas. The shortage result in high nurse-patient ratio, longer duty schedules, less work time flexibility, which may result to burnout. Burnout is a well-studied syndrome in healthcare associated with various professional and personal consequences. It is defined as a syndrome that consists of emotional exhaustion, depersonalization, and reduced personal accomplishment. Empowering leadership has been seen as a type of leader behavior which contributes positively to the psychological empowerment, attitudes, and work behaviors of followers. This project seeks to answer the following research objectives: nurses' perception of their supervisors' leadership empowering behaviors, their current working conditions, level of burnout, differences on the burnout considering the different demographic variables, and the relationship of leadership empowering behavior, working condition, and burnout. The project is descriptive correlational design. The data will be collected from all nurses in different departments. Questionnaires will be given to respondents containing 3 scales. Data will be analyzed using SPSS. Research question will be tested using Pearson product moment correlation coefficient. In conclusion, the result of the study will serve as a guide for the hospital administration and the nursing service department on their human resource management plans. It will enable them to identify significant facts affecting nurses' burnout and improve leadership empowering behaviors of their supervisors. It will highlight the importance of the leadership role in creating a positive work environment by enhancing meaningfulness of work expressing confidence in employees' ability to perform at a high level and providing autonomy. Furthermore, the study will help them develop strategies in retention, improving the nurses' performance level, their organizational commitment, as well as the delivery of quality patient care. And this ends my presentation. Thank you very much.
Thank you, Dr. Joanna Pavella Flores. The next presenter presenting her thesis, Optimizing the Patient Safety Culture in Secondary Level Private Hospital in Metro Manila through a organizational leadership, ship management, and innovation. We call on Dr. Rosenia Gutierrez.
Optimizing the patient safety culture in a secondary level private hospital in Metro Manila through its organizational leadership management and innovation. Hospitals are organized as a tri-service healthcare system composed of administrative, nursing, and medical. The issues and concerns of these services are integrated and tackled during the hospital's management committee regular monthly meeting. One of the MAN meetings, the Quality Assurance Committee presented nonconformities to the quality standards that compromise patient safety. The reports on the patient safety related incidents serve as signals for the Patient Safety Committee to pursue its desire to develop and conceptualize measures that will promote optimizing the patient safety culture within the hospital. The problem that the committee wanted to address is how can organizational leaders help in optimizing the patient safety culture within the hospital. The following research objectives are aimed to address the issue, to identify and describe the important and critical patient safety concerns in the hospitals, to determine the insights of the hospital leaders in addressing important and critical patient safety concerns, to measure the current patient safety culture in the hospital, and to develop a concept for the hospital leaders in optimizing the current patient safety culture in the delivery of healthcare. The research design will be purely descriptive study which will utilize both qualitative and quantitative methods. It will involve key informant interview and focus group discussions for the qualitative and the use of a self-administered survey questionnaire for the quantitative methods respectively. The questionnaire to be used is a pre-tested one, the Hospital Survey on Patient Safety Culture of the Agency for the Healthcare Research and Quality, and this tool has been used by researchers in patient safety culture studies worldwide. The study will be conducted in a level 2 private hospital among selected participants. They will be composed of hospital personnel with direct contact with the patients, such as the physicians, nurses, and other allied healthcare professionals. Those in the hospital service support system, like the hospital administration staff, and most especially the supervisors, managers, and administrators. In the conduct of the research study for this project, concerns on openness for feedback and communication about error can be obtained. Likewise, perception of punishment errors can surface. Attribution to patient healthcare ratios can be highlighted too, as well as other administrative-related concerns. In determining the organizational leaders' strategies into addressing critical patient safety concerns, recognition and allocation of budget can be identified too. Training on awareness of patient safety will surely be on top of the concerns that can be mentioned by the participants during the FGD. Enhancing the current strengths of the patient safety culture and normal ideas and innovations can arise as a result of adopting best practices of other institutions in the course of this study. Evaluation of the safety culture to the survey tool can provide data on the management's actions on promoting safety and how the system is able to provide training for improvement of its workers individually and as a team. Non-communication of adverse events due to fear of punishment must be identified in the process. Such evidence serve as references for leaders in conceptualizing innovations geared toward improving and transforming patient safety policies into a blame-free system, thus promoting sharing of incidents and adverse events so it can be corrected and eventually help improve healthcare system and promoting quality care.
Thank you, Dr. Rosenia Gutierrez. The next presenter, presenting their title, Flight and Flight Response, the Live Experience in Auxiliary Service Provider in Metro Manila, in the midst of COVID-19 pandemic. May I call on Dr. Christine Gutierrez and Dr. Teresa Reyes Samson.
A pleasant day to everyone. We are Doctors Christine Gutierrez and Maria Teresa Reyes Samson, and we are here to present our paper entitled Fight or Flight Response: The Lived Experiences of Ancillary Service Providers in the Metro in the Midst of COVID-19 Pandemic. COVID-19 pneumonia pandemic is globally spreading at an accelerated pace and rate. While there was a daily report of total diagnosed cases and deaths across the world, what was less known were the challenges healthcare providers and facilities faced during this pandemic. It is with this reason why massive attention must be given to these ancillary service providers as they continue to serve as frontline personnel in the fight that is still going on up to date. Overall, the current study entails how ancillary service providers perceive their thoughts and feelings, as well as their take on the current scenario, with the target of promoting knowledge and awareness within these employed individuals through better understanding of their experiences. For the research design, we used a qualitative approach which is applicable when little or nothing is known about the situation, and we also used a phenomenological approach, which are based on paradigms of personal knowledge and emphasize the role of personal perspective and interpretation. 8 participants were individually interviewed, with interview sessions targeted to last for an estimated duration of 1 hour and 30 minutes per participant, covering a minimum of 3 interview sessions and a maximum of 5 interview sessions. Interview sessions were signaled to end when the responses of the participants were exhausting or repetitive, given that substantial information was already gathered. The following instruments were used in the data gathering procedure. First is your MMHoA or memory aid, which consists of documents, questionnaire, and was used to facilitate interviews, which are semi-structured in nature. Second is your audio recorder or voice recorder, which is used to collect information from the participant statements verbatim from the interview. You also have your laptop, and you also have your consent form and information sheet, which provides sufficient information to enable potential recruits to make an informed choice regarding whether or not to participate in the project, and will clearly state that they are liberal to withdraw at any time. The data obtained from the interview were analyzed through the use of thematic analysis. Thematic analysis includes labeling concepts and defining and developing categories based on their properties and dimensions relevant to the scope of the study. It is a qualitative method that can be used when working in research teams and analyzing large qualitative data sets. The goal of thematic analysis is to identify themes and patterns in the data that are important or interesting and use these themes to address the research. Generally, it can be deduced that there is indeed a lack of preparedness globally when it comes to healthcare services, healthcare workforce, and healthcare provider support programs. Findings relative to the COVID-19 pandemic and its impact to healthcare providers overall will be helpful for countries and organizations to prepare in advance for more stringent COVID-19 pandemic crisis and other similar events or diseases. In the event of a virus pandemic, motivating healthcare workers to report is a big challenge. A challenge that we cannot afford to lose given the demand needed to aid COVID-19 patients. Moreover, although resilience is a well-studied concept in healthcare service, a high-pressure environment accelerates symptoms of burnout, such as moral distress and compassion fatigue. These must all be given attention and assistance, as it may lead to a negative domino effect across healthcare workers, their families, and their patients overall. Admittedly, there is still a huge lack of data and research given the indefinite duration of the pandemic, including the restriction on possible efficient techniques and methods. Moreover, there is no one stream in all of the experiences our healthcare workers encounter.
It varies per industry, specialization, area, scope, and economic status. Therefore, this current research is very limited to its scope and is not generally conclusive. More longitudinal researches and intervention programs must be taken into consideration for COVID-19 related research. Indeed, more studies are needed to evaluate healthcare workers' experiences in dealing with COVID-19 pandemic across countries, given that resources and experiences vary. Through research like the current study, strengthening and enriching clinical enterprise research may be given more focus and funding by the government. Thank you very much, and again, a pleasant and safe day to everyone.
That's Fight and Flight Response by Dr. Christine Gutierrez and Dr. Maria Teresa Reyes Samson. The next presenter presenting their title, in fact, of antimicrobial stewardship program on the antibiotic use prevalence in a primary hospital. Let me call on Dr. Eileen Laksamana and Dr. Eileen Santos. Ellen Santos, sorry.
Proposal is entitled Impact of Antimicrobial Stewardship on the Antibiotic Use Prevalence in a Primary Hospital. The global health problem of antimicrobial resistance can be prevented through a concerted action of responsible prescribing and usage of antibiotics among the clinicians worldwide. The World Health Organization has declared antimicrobial resistance as one of the top 10 global public health threats of humanity, and because of this, a global action plan on antimicrobial resistance was developed in 2015. In Southeast Asia, only 42% of the countries have national AMS standards, as opposed to the worldwide proportion of 52%. In the Philippines, the Department of Health, through the Administrative Order 2019-002, titled Implementing Guidelines on the Philippine Antimicrobial Stewardship Program for Hospitals, mandated all hospitals to establish an effective and efficient AMS program involving a multidisciplinary, multi-intervention, and coordinated strategy to optimize the use of antimicrobials. However, there are several challenges to AMS implementation, as can be viewed in this slide. The rationale for this capstone project is as follows. Antimicrobial resistance is a public health crisis and a threat to national security. This problem is multifactorial, but we know that the development of AMR can be prevented through regulation and correct antimicrobial usage. In a resource-limited facility, AMS program will benefit the patients, the physicians, and the hospitals. The aim of the project is to reduce unnecessary utilization of antibiotics among the patients admitted in a primary hospital through the implementation of antimicrobial stewardship program. The specific aims are as follows. The project setting is a primary hospital with 100 beds with specialties of internal medicine, obstetrics and gynecology, pediatrics, and general surgery. It has around 45 employed medical specialists. The project will run in 4 phases. So policy development phase, capacity building phase, implementation phase, and post-implementation evaluation. The project team will be closely coordinating with a dedicated AMS team of the hospital. This slide shows the policy development phase and the capacity building phase plans. The project team, together with the hospital's designated AMS team, will create the guidelines for the implementation of a pharmacist-led restrictive approach, taking into consideration the action measures. The pharmacists will stop dispensing antibiotics based on the auto-stop policy, and the nurses will stop administration of drugs as well. Audit feedback will be conducted by the AMS physician weekly and will be relayed to the attending physicians. There will be an evaluation of the project 6 months from its implementation. The following are the process measures and the outcome measures that will be determined by the project team. There are limitations and challenges with this project. However, the team is hopeful that the implementation of the AMS in the hospital will be a success and that the action measures will be met. Thank you very much.
That's it, the impact of antimicrobial stewardship program with Dr. Eileen Laksamana and Dr. Ellen Santos. The next presenter presenting with her title, Health-Seeking Behavior of Stroke Patient at Tertiary Government Hospital in the Philippines during the COVID-19 pandemic. May I call on Dr. Patricia Olartelli.
Good day. I'm going to discuss my paper. This is the title. I'm Patricia B. Olartelli, MD, FPNA. I had my Doctor of Medicine at UERM and residency and fellowship in neurology and in stroke and neurovascular neurology at JRR MMC. I'm currently based in Tacloban with my husband and practicing at ACE Medical Center and these other hospitals. Stroke is the most common cause of deaths worldwide and the most common cause of disability. The duration of ischemia plays a crucial role in determining the outcome of ischemic tissue and clinical outcome. At present, reperfusion therapy with IV-RTPA or intravenous recombinant tissue plasminogen activator is the treatment of choice. However, the rate of IV-RTPA use for stroke only ranges from 1.3 to 9% among Asian countries, as less than 30% of patients arrive in time to be candidates for TPA. SARS-CoV-2 virus pandemic and its clinical syndrome, COVID-19, has disrupted established career pathways, including those for acute conditions such as acute ischemic stroke, although workforce allocation has been maintained as much as possible, especially in government training hospitals. In the Philippines, little published literature on whether COVID-19 has directly influenced health-seeking behavior in patients with stroke symptoms are available. Therefore, we performed a retrospective analysis reviewing the charts of consecutive patients admitted with transient ischemic attack or TIA and stroke admitted via the acute stroke pathway at JRR MMC during the first 60 days since the first diagnosed COVID-19 case in the Philippines, January 30, 2020 to March 29, 2020. The number of admissions, stroke onset to hospital arrival, and the timings of inpatient stroke pathways with patients admitted during the same period in 2019 or pre-COVID were compared. Patient list and information were retrieved from the hospital's Department of Neurology's stroke registry. Patients with subarachnoid hemorrhage were excluded from this study. Baseline demographics, vascular risk factors, stroke subtype and severity, and details of acute stroke treatment of patients during the COVID-19 and pre-COVID-19 periods were collected. Stroke onset to door time was defined as the duration of onset of symptoms or the last known well time to the arrival at JRRMC Neurology ER. Baseline demographics, vascular risk factors, and stroke subtypes and severity, as well as stroke onset to door time and critical time points in inpatient acute stroke care between COVID-19 versus pre-COVID-19 were compared using t-test, z-test, chi-square, and Mann-Whitney U-test where appropriate. A p-value of less than 0.05 was considered statistically significant. So for the statistically significant results, it is interesting to note that the mean age of patients seeking consult increased significantly by around 3 years compared to 2019. Younger patients with stroke symptoms may choose not to come to the hospital at all, while families have probably been more determined to bring their parents and elderly relatives in for admission, increased social isolation of the younger patients compared to the older ones living with their children now may also have decreased the chances of friends and family members recognizing that the patient was having a stroke. Another point of interest is that the proportion of patients with diabetes mellitus seeking hospital care was significantly increased. A significantly higher proportion of patients admitted during the COVID-19 had DM or diabetes mellitus compared with pre-COVID-19. This may be due to the substantial difficulty seeking outpatient care for this comorbid condition during this time and coming to the hospital to address this. The stroke symptoms may present as an opportunity to also address the diabetes. During the given period, patients with TIA and stroke were admitted through acute stroke pathway during COVID-19 pandemic. This was 96 patients, a remarkable 31% drop from the 139 patients seen at the same period in 2019 pre-COVID-19. The proportion of patients arriving within 4.5 hours during the pandemic was also lower by around 2.2% compared to pre-COVID-19 time. However, the correlation was not found to have statistical significance. This may be due to having relatively better traffic situation for essential travels like hospital admissions despite the travel restrictions in general during that time. The results, although unchanged, still show unsatisfactory health-seeking behavior in patients in that a relatively small percentage arrives within the therapeutic time window of IV RTPA. Patients not coming to the hospital for acute stroke care is nothing new. However, this may be more prominent during the COVID-19 pandemic. Failures and delays in seeking care proved to be detrimental to stroke outcomes. Time is brain, and earlier intervention lead to an increased chance of preventing a completed stroke in TIA, reperfusion for ischemic stroke, and of prevention of hematoma expansion in hemorrhagic ones. Further studies focusing on the changes in stroke patients' attitude and behavior during COVID-19 are warranted. This study is limited by its retrospective nature and the inclusion of a single stroke-ready government hospital. Although results reflected patients' possible hesitancy to seek hospital care, this was not confirmed with the individual patients due to the retrospective nature of the study. Proper education, including both stroke awareness and COVID-19 knowledge, is crucial in countries affected by COVID-19. Stroke awareness education activities should not be stopped during the pandemic. They should instead be enhanced. So these are my references. Thank you.
Thank you, Dr. Patricia Lartely. The next presenter with his title, Assessing the Knowledge, Attitude, Practice Toward COVID-19, a cross-sectional study on 1 year after. Let me call on Dr. Stephen Yapley.
Good evening, everybody. I'm Stephen Yapley, and I'll be presenting my paper. So let's start. My paper is titled Assessing the Knowledge, Attitude, and Practices Toward COVID-19, a cross-sectional study 1 year after. The study highlights the general knowledge of participants with regards to SARS-CoV-2, their attitude towards the disease, and the practices in their daily lives that have and will impact their health. Demographic data and statistical analysis for correlation of knowledge and attitude to practices are also done. With my thesis statement, the knowledge, attitude, and practices of both the general public and healthcare workers are not adequate in dealing with COVID-19 as there is continued rise in the number of infected people. Despite having adequate knowledge, it also does not automatically translate into good attitude and practices. The Philippines has placed high in the most number of confirmed cases, despite having the longest lockdown. At the time of writing, the Philippines ranked 23rd in the world with the longest lockdown since March 16, 2020 and up to the present writings, January 2021. As the World Health Organization General Director, Dr. Tedros Ghebreyesus said, we are not just fighting an epidemic, but an infodemic. This is because of easier access to social media and government campaign drive. Knowledge is abundant, but there's always danger of misinformation. Lack of information and confusion in the knowledge gained, as cited by Sackline et al., leads to delay in diagnosis, continued spread, and poor sanitary and infectious protocols. The World Health Organization, together with the governments around the world, have launched information drives that aim to educate and teach people on what COVID-19 is all about and measures that can be done to stop its spread. The knowledge gap must be filled so that behavioral alterations can be done. For methodology, results, and discussion, sampling size 377 was taken using the Rausoff sample size calculator with margin of error of 5% and confidence interval of 95%. Sampling was done from January 5 to January 31. A 50-item questionnaire adapted from the study of Amin Mirza was used. For the 50 items, the first part was demographics, 8 items, followed by the knowledge, 12 items, attitude, 12 items, then practices, another 18 items. For knowledge, a score of 18 and higher was deemed adequate, while lower than 18 was inadequate. For attitude and practice, scores less than 50%, 50 to 75%, and more than 75% were classified as weak, moderate, and good, respectively. The questionnaire was validated by 6 health educators and health promotion specialists. The results showed 9 out of 10 participants had adequate knowledge. There was one who had inadequate knowledge. 8 out of 10 participants had good attitude, while 2 had moderate attitude, and all participants had good practices against the COVID-19 virus. So good knowledge, attitude, and practices was most probably due to the fact that the participants were all healthcare workers or connected to a healthcare facility. And having adequate knowledge doesn't automatically mean good attitude and practices. For a recommendation and conclusion, further studies can be done in different cities and compare them to one another to assess which cities lack knowledge, attitude, and practices. In addition, further studies comparing urban versus rural communities can be done. This is to know whether there is inadequacy in rural areas compared to urban areas, so that efforts can be directed towards them. In both settings, the local LGU can be tapped to intensify the information drive. The information drive by the World Health Organization and government agencies proved to be effective for the participants as they had adequate knowledge, attitude, and practices. Thank you.
Thank you, Dr. Stephen Yapley, the next presenter, with his title, Knowledge, Attitude, Practice. Knowledge, attitude, practice toward COVID-19 among healthcare worker in tertiary psychiatric hospital in Metro Manila. Dr. Glenn Minorcate.
Good day, I am Dr. Glenn Minorcate, and I am here to present my project proposal with the title Knowledge, Attitudes, and Practices Towards COVID-19 Among Healthcare Workers in a Tertiary Psychiatric Hospital in Metro Manila, Philippines. So what is the significance of this project? Despite leaps and bounds in acquiring present knowledge about behavior, epidemiology, and management of COVID-19, there exists many application gaps in hospital protocols that ensure safe handling of non-COVID patients with specific needs. Patients who depend on long-term institutionalized care are unwittingly exposed daily to healthcare workers that are not properly trained in virus containment and are therefore potential sources of cluster infections in a center that is not designed or equipped to handle infectious disease. So what is the aim of this project? This project study aims to determine any gaps in knowledge regarding the management of patients suspected of and or confirmed to have COVID-19. This also includes the assessment of the knowledge, skills, and attitudes involved in the prevention and spread of disease among healthcare workers. This will involve the use of a self-developed piloted questionnaire that will be distributed among the 3,200 medical, nursing, and ancillary staff via remote online forms after a pre-testing period. Once duly accomplished, knowledge scores will be computed and compared with demographic characteristics as well as attitudes and current practices via bivariate analysis. The study will be done within a period of 3 months. So here is a sample of the questionnaire that we are planning to use for this study. The discussion is expected to focus on gathering information that will determine any gaps in knowledge and clinical practice among healthcare providers that cater to patients with specific needs in non-COVID referral centers, such as the institution described. The results of this study will form the framework of strategic management policies for safety of patients and hospital personnel and can be a repeatable impact study as guidelines evolve along with the dynamics of virus behavior. Thank you very much for your time.
Thank you, Dr. Minorquete. The next presenter, with her title, Prevalence of COVID-19 Related Burnout Among Healthcare Personnel in Tertiary Government Hospital. I call on Dr. Cristina Nieves.
Good afternoon. I'm Cristina Nieves, and I'm here to present my study, Prevalence of COVID-19 Related Burnout Among Healthcare Personnel in a Tertiary Government Hospital. Burnout is a psychological syndrome characterized by emotional exhaustion, depersonalization, and a sense of reduced accomplishment in day-to-day work. Burnout has been increasingly common among medical staff workers and is being recognized as a factor that can affect patient care quality. Healthcare is a demanding and stressful profession with severe consequences if there's poor decision-making as it impacts patient care. Determining the prevalence of burnout among health workers amid the pandemic would help the healthcare institution address the concerns of its staff and maybe come up with a solution to prevent burnout. This study consists of a cross-sectional descriptive design using an online survey among healthcare workers that was conducted between July to August 2021 at a tertiary government hospital in Manila. Convenience sampling was used and a sample size of 100 was derived, consisting of doctors, nurses, nurse aides, and administrative staff. Demographic data will be collected such as age, gender, marital status, working hours, and area of work. The instrument to be used for data collection will be the Maslack Burnout Inventory for Medical Personnel by an online survey. The survey is a reliable and valid self-assessment measuring tool used across multiple cultural settings and occupations, including healthcare professionals. It consists of 22 items constituting 3 subscales: emotional exhaustion, depersonalization, and personal accomplishment. A total of 108 healthcare personnel were recruited and consented to participate in the study. As a result, based on their MBI score, 21 of the 108 participants, or 19%, have burnout symptoms in this study. Concerning gender effect on burnout syndrome, other studies show that females were more likely to have higher emotional exhaustion scores. However, in this study, male healthcare personnel were the ones who were more liable to burnout than females. Age was discovered to be a factor impacting MBI score in this study. The age group of 30 to 39 years old had the highest percentage of burnout syndrome. This is similar to other studies showing that the younger generations had a higher likelihood of burnout. This could be attributed to the workload and lack of work experience at the beginning of their careers. Additionally, juniors have more contact on the front line with COVID-19 patients than senior staff members. In regards to marital status, single healthcare workers were more liable to burnout than married ones. One study was similar to this study's results and reported that being married was significantly associated with higher levels of personal accomplishment. This may be due to the support given by a partner. This study also showed that type of profession showed a difference in the likeliness of burnout among the staff. Those in the front line, such as doctors and nursing staff, had higher emotional exhaustion scores, but similar personal achievement scores with the administrative staff. This could be attributed to the fear of contracting the disease in the line of duty, the heavy workload frontliners have to face daily, and the issues of salary compensation. Reports of an increase in the frequency of night shifts per month were associated with an increased risk of burnout. As for work experience, experienced senior healthcare workers showed better scores in the three scales. This may be attributed to the calmer and better capability of facing or managing occupational stressors. They may feel more successful in their work and more resilient to burnout. For my conclusion, the findings of this study offered an early insight into the severe problems facing healthcare professionals who are currently working at the front line in this pandemic. This study can provide guidance for possible interventions. After identifying all these factors that make each healthcare worker prone to burnout, preventive and interventional programs should be applied in healthcare organizations during this pandemic. Finally, a formalized burnout reduction program can be offered within the institution or even in other hospitals to alleviate burnout concerns. Experts have claimed that the trajectory of the pandemic is still unknown, thus the importance of addressing long-standing burnout among healthcare workers. Thank you.
Thank you, Dr. Cristina Nieves. The next presenter, with their title, the Determinants of Risk Rating Scale in Quality Management System, ISO 9001 2015, Vital Variables in Action Planning. I call on Dr. Danilo Poblete and Dr. Deo Hertas Talanay.
A pleasant day, everyone. Today, I am going to present our project proposal entitled The Determinants of the Risk Rating Scale in Quality Management Systems, ISO 9001:2015, Vital Variables in Action Planning. The proponents are as follows: Danilo A. Poblete, MD, and yours truly, Deo Hertas Talanay, MD. For project abstract, quality assurance in healthcare is focused on identification and prevention of errors on various hospital processes with an overall goal of safety for both patients and healthcare workers. These can be done through a systematic hospital accreditation process by ISO, or International Organization for Standardization, or JCI, Joint Commission International. This project paper would like to discuss and analyze the setting of risk rating for each process in the hospital quality management systems. To be more specific, the study would like to identify the determinants of the risk rating scale in accordance with quality management system, ISO 9001:2015, which are considered vital variables for action planning.
This will be a retrospective review of 153 risk assessments on quality management systems done by 31 departments and section heads of the hospital from January 2019 to January 2020. From each risk assessment, common variables will be identified and the risks will be categorized as low, medium, or high. During risk evaluation, risk rating will be set as it is directly affected by the probability of the risk to occur, the impact of the risk on the process, and the control instituted to lower the risk. Embarking on ISO certification is highly recommended for hospitals with ultimate goal of overall patient safety. Internal auditing based on clause-by-clause analysis and risk assessment are fundamental processes involved in ISO quality management system standard. From the initial evaluation of data, the proponents noted that manpower, training, leadership, and complexity of the hospital processes are the determinants in the risk rating scale for which pertinent action plans will be proposed. The proponents of the study surmise that risk rating can be standardized based on identified determinants which strongly affect the risk and subsequent action plan. Therefore, it is important to complete the study in order to prevent subjectivity and empirical designation of the risk rating cut-off prior to action planning. Thank you.
Thank you, Dr. Danilo Poblete and Dr. Deo Talanay. The next presenter presenting her title, Impact of SARS-CoV-2 Virus Transmission to Asymptomatic Healthcare Workers and its Implication toward Manpower Capacity through Mobilization of Contingency Plan. May I call on Dr. Maria Corazon Reynes.
I'm Dr. Reynes. My research is about the impact of SARS-CoV-2 virus transmission to asymptomatic healthcare workers and its implications towards manpower capacity through mobilization of contingency plans. The objectives are to identify the impact of SARS-CoV-2 virus transmission to asymptomatic healthcare workers, to depict the effects of the virus transmission to the decrease in manpower capacity, and to discover effective institutional operational systems that may become methodological contingency plans for the benefit of safe healthcare delivery. The Centers for Disease Control and Prevention has announced that each healthcare institution must develop strategic contingency plans to ensure asymptomatic clinicians' safe return to work. Healthcare institutions must abide by standard methods to ensure they meet the requirements for discontinuing transmission-based protocols. According to Shaukat et al., COVID-19 may impact healthcare workers in both their physical and mental aspects. These are direct consequences due to rendering care to COVID-19 patients. The virus has a significant impact on the job performance of asymptomatic healthcare workers. Shaukat, Ali, and Razak mentioned in their study that effective strategies to compensate for the decrease in manpower included shorter length of work shifts and support for mental health are vital as health preservation strategies. For the research design, the descriptive correlational method shall be utilized in the study to define the impact of asymptomatic COVID-19 infected healthcare workers on the decrease in the hospital workforce. Correlational research is a methodical assessment of the relationship present between two or more variables. Quantitative research approach shall be utilized in analyzing and recognizing the predictor and criterion variables. A set of standardized questions shall be employed to gauge the effects, including demographics. Convenience sampling shall be utilized as respondents are selected based on availability and willingness to take part through a questionnaire survey. Pearson's correlation shall be utilized to investigate the relationship between two quantitative continuous variables. The data gathered shall be encoded and analyzed in Microsoft Excel and processed in IBM SPSS to get the descriptive statistics. The Pearson correlational test was used to see if there is a strong association between the variables and to produce the results of the study. The data was analyzed for Pearson correlation with a significance value of 0.01 and two-tailed test to determine if the data was statistically significant. The statistical test showed that asymptomatic healthcare workers revealed a moderate correlation with their job performance. The research question, do asymptomatic healthcare workers have a significant impact in their job performance due to manpower depletion? The conclusion of this study is that due to being asymptomatic, the job performance of healthcare workers who tested positive was affected. Through this research project, healthcare workers may enhance their knowledge as to how to deal with a sudden increase in the incidence of virus transmission. This may encourage future researchers to have investigations on the effective operational systems to make way for improvements in medical interventions. Researchers may venture into specific alternative work schemes that would allow continuity of work in the presence of the pandemic. This research shall lead to the discovery of subsequent mobilization of contingency plans set to guide and direct healthcare workers for future measures. These are my references. Thank you.
Thank you, Dr. Corazon Reynes. The next presenter with her title, The Use and Acceptance of the Adoption of Telemedicine Among Surgeons in San Pedro Hospital, Davao City during the COVID-19 pandemic. I call on Dr. Lucille Ann Encarnacion Ronco.
A pleasant day to everyone. I am Dr. Lidsel Ann Encarnacion Rongo, and I'll be reporting on my research entitled The Use, Acceptance, and Adoption of Telemedicine Among Surgeons in San Pedro Hospital, Davao City during the COVID-19 pandemic. The rationale of the study will investigate the perception of surgeons on telemedicine and the limitation of its usage. The result of this study will give light on the current trend of consultation done by surgeons in the light of the pandemic and with the problems identified on its non-usage. Recommendations can be done on how to make it more appealing to the surgeons so as to help curb the spread of COVID-19. In addition, with the results of this study, San Pedro Hospital can weigh if they can offer telemedicine as one of their main services. This will ensure continuous health care to people despite the threat of COVID-19. For the methodology of this study, this will be a descriptive design. A survey questionnaire will be utilized to evaluate the surgeon's perception on telemedicine during the COVID-19 pandemic. The survey questionnaire will be created on Google Forms. A 5-point Likert scale will be used for the items investigating the satisfaction of surgeons regarding a particular aspect of telemedicine on a specific type of patient. The responses of the participants will be kept anonymous and confidential. Responses will be collated and entered in a Microsoft Excel. The survey questionnaire will have 5 major sections focusing on surgeon demographics, alternative media for telemedicine, telemedicine for new patients, telemedicine for follow-up patients, and telemedicine for post-operative patients. All the subjects will be surgeons practicing in San Pedro Hospital, Davao City. Surgeons will be asked about their overall satisfaction, their satisfaction with establishing rapport, satisfaction in doing physical examination, and satisfaction with securing imaging in a timely manner among new patients, follow-up patients, and post-operative patients. In addition, reasons for non-usage of telemedicine will also be examined. Furthermore, the study will also investigate if surgeons will continue to use telemedicine post-COVID-19 and their reasons for discontinuance if such. All statistical analysis will be performed utilizing SPSS. Descriptive statistics will calculate for all continuous and categorical variables. Continuous variables will be reported as weighted mean and estimated standard deviation, whereas categorical variables will be reported as frequencies with percentages. For the results of this study, 24 out of the 30 consultants in the Department of Surgery in San Pedro Hospital responded to the survey. 62.5% of the respondents used paper medical record. 50% of the surgeons in the department are not using telemedicine nowadays. And the major reason for non-usage of telemedicine is the inability to do physical examination at 91.7%. Under the alternative media for telemedicine, so 50% of the surgeons in the department are using telemedicine nowadays. The major beneficial effects seen in using telemedicine are public health safety amid the pandemic at 83.3% and patient convenience at 75%. Only 12.5% of the surgeons had been using telemedicine before the COVID-19 pandemic, but as a result of the pandemic, it has quadrupled its usage to 50%. The most commonly used medium for telemedicine is cell phone at 66%. The overall satisfaction with telemedicine is at 3.17. Majority of the respondents at 50% spend 1 to 10 minutes in doing telemedicine. Under telemedicine for new patients, so among those who use telemedicine, 58.3% use it for new patients. The main reason for those who do not use telemedicine for new patients is the lack of physical examination at 80%. The overall satisfaction with telemedicine for new patients is 3.14, with the highest satisfaction with imaging and the lowest satisfaction with physical examination. Overall, 85.7% of the surgeons plan to continue using telemedicine post-COVID-19 for new patients. Among those who do not wish to continue telemedicine post-COVID-19, the major reasons are physical examination and rapport. Under the telemedicine for follow-up patients, among those who use telemedicine, 83.3% currently used it for follow-up patients. The most common reason for not using telemedicine for follow-up patients are they're not interested and the inability to do physical examination. The overall satisfaction with telemedicine for follow-up patients is 3.6. The highest satisfaction is with patients' rapport, while the lowest satisfaction is at the lack of physical examination. 80% of the surgeons plan to continue using telemedicine post-COVID-19 for follow-up patients. Among those who do not wish to continue telemedicine post-COVID-19, major reasons again are the lack of physical examination and building rapport. For the telemedicine for post-operative patient, so among those who use telemedicine, 75% currently used it for post-operative patients. The most common reason for not using telemedicine for post-operative patients is the lack of physical examination. The overall satisfaction with telemedicine for post-operative patient is 3.78. The highest satisfaction is with patient's rapport, while the lowest satisfaction is with a lack of physical examination. Overall, 77.8% of the surgeons plan to continue using telemedicine post-COVID-19 for post-operative patients. Among those who do not wish to continue telemedicine post-COVID-19, major reasons again are the lack of physical examination and the inability to have rapport with their patients. In conclusion, we can derive from this study is that there's an increase in the use, acceptance, and adoption of telemedicine among surgeons in San Pedro Hospital. The COVID-19 pandemic has made surgeons more open in embracing telemedicine in dealing with their patients, with public safety as their top reason. The major dissatisfaction is consistently shown from the inability to perform physical examination. Majority of respondents expressed the desire to continue using telemedicine post-COVID-19. The main implication derived from this study is that telemedicine is definitely here to stay and has brought change in the mode of consultation between doctors and patients. We can definitely anticipate that more and more doctors will be using this kind of consultation, especially now that there's still uncertainty until when this pandemic will end. Because of the familiarity and convenience brought about by telemedicine, doctors will definitely incorporate this and become one of the mainstays in doing consultation, even if the pandemic is gone. And with that, I end my report. Thank you everyone for listening and have a great day.
Thank you, Dr. Lidzil Ann Encarnacion Ronco. The next presenter, with his title Intrinsic and Extrinsic Factor Affecting Student Performance Among Junior Medical Technology Student in Hematology, may I call on King Limuel Santiago. Sir.
Good morning, everyone. This is King Limuel Santiago, taking Master in Management, major in Public Health Administration in Philippine Christian University Transnational Education and Extension Program. For today, I'll be presenting my project, Intrinsic and extrinsic factor affecting student performance among junior medical technology student in hematology. An overview of this study. One main objective of medical education and education in general is to produce long-term learning, not just memories which perish quickly after given lecture, conference, or test. This raises a vital issue to show how educational process have the capacity to shift learning into long-term memory. Schools across the nations are experiencing ever-increasing pressure to raise student test scores to meet the growing demand of students' achievement. Educators at all levels have created and implemented strategic plan that focuses on adult controlled variables such as professional development and purchasing of computer-based learning programs. The purpose of the study was to examine the relationship among intrinsic and extrinsic factors that affect the academic achievement of the student. The background of this project. The cause of the lowering basic knowledge developing in clinical years of the student is due to lack of clinical textbook, science setting, and significant ideas which are generally not required in the exams so that the concepts are slowly forgotten. One of the best ways to ensure that you succeed in school is to find sources of motivation. There are two main types of motivation. There are intrinsic motivation and extrinsic motivation. Intrinsic involves internal motivators such as desire to do well for your own pleasure. Extrinsic is motivation involves external motivators such as rewards and good grades. Through this process, the researcher can evaluate the respondent depths of thinking and how they view intrinsic and extrinsic factor that affects the academic performance of junior students in hematology subject. The gathered data is determined whether there are points of comparison or marked difference in their interpretation of ideas under the study. Solution and approach that is used for this study. This study applied theories of action. First is teacher tried to make their lecture simpler and more understandable. Second is original class size were divided into two smaller class. Third is teacher tried to give reward and motivation during recitation and interaction. Lastly, students nowadays are visual learners. That's why the teacher conceptualized their lecture through PowerPoint and video clips. Some constraint to the learning were identified. The student problem, like they're having a difficulty understanding the concept in hematology, and mentioned different learning capabilities of student due to the presence of distractions like television, social media, cell phone, video games, and others. The facilities like big and aircon classrooms are really play a vital role in improved learning condition for the learners. Student shows remarkable improvement in getting good grades in their major exam and quizzes. They participated more in the discussion, interactions with classmates as well as with the teacher, and with regards to the laboratory exercises, they have initiative to perform, always attending their class. Result of this study have yielded a marked difference in the interpretation of the concept under study of intrinsic and extrinsic factor that affects junior medical technology student in hematology subject. Students gathered indicate that English language, whether in written or oral, is very significant to every student in professional subject, particularly hematology. Reading textbook, manuals, and journal needs a lot of understanding since all of them were written in English. It is also one of the aspects that provides students interact with teachers and classmates, especially with classmate is a foreigner. We very well know that there is a lot of foreigner students studying here in the Philippines, specifically in medical and allied health courses. Gathered information revealed that the interference of psychological problem like establishing relationship within peer group and sudden independence from parents, students, academic performance, hence time management skills, and most important aspects for all students to have a better academic achievement in major professional subject, particularly in hematology. The conclusion of the study. The major intent of this qualitative inquiry was to uncover the essence relative to the central question, how is the intrinsic and extrinsic factor affect the academic performance of junior medical technology student in hematology subject? This phenomenological analysis, which consisted of analysis and seeking of the essence, helped reveal the descriptive evaluative research focusing on extrinsic and extrinsic variables. Gathered data from the robot photo were tallied and analyzed, granting that the language discovered by the researcher can be consistent. The researcher took as separate entities. Essence were taken not as a whole, but individual with their own separate foundation. The researcher recommended that further studies should be made to identify the relationship of the intrinsic and extrinsic factor that affects the student's academic performance, as well as on how to improve their learning style and study habits. No research has been done in context of medical technology or in medical laboratory science.
Thank you, Mr. Kim Limuel Santiago. The next presenter with the title ENT Teleconsultation Service by Dr. Maria Rosa Santos. May I call on Dr. Maria Rosa Santos.
Hello, my name is Maria Rosa Santos. I am an ENT otolaryngologist practicing in the Makati area. My project paper is entitled Ear, Nose, and Throat Teleconsultation Service. Executive summary. A non-medical grade and commercially available endoscope can be plugged into the patient's mobile phone or even laptop and show and capture images of the ear, nose, and oropharynx. Captured images are sent to the ENT for evaluation. It is an economical and safe way to inspect the ear, nose, and throat. The intention of purchasing this device is to be bundled with the ENT teleconsultation service package. Project background. Teleconsultation is a safe way to take the history of the patient's complaint. For the ENT, teleconsultation presents a unique dilemma. How can an ENT perform an online examination of their patients but still adequately visualize the ear canal, anterior nasal cavity, and the oropharynx? Should ENT skip the inspection of the area that ails the patient altogether? In general, physicians are able to arrive at a diagnosis with taking a good history. However, a pertinent finding on physical exam may change the initial impression in 26% of cases. Therefore, a physical examination will contribute to the precision of a physician's diagnosis. Solutions and approach. A simple and affordable option can be offered by the ENT specialist to patients that would like to avail of a safe and convenient home checkup. An ENT consultation package, which includes 1, the fee for a teleconsultation with an ear, nose, and throat specialist. 2, a fiber optic endoscope attachment. 3, delivery of the scope to the patient. ENT practitioners may have misgivings with using this system, endoscope system, for their patients. However, according to study by Cafino, captures, and it is true, cameras captured lower quality images when compared to the medical grade endoscopes. However, the USB endoscopes provided enough visualization to aid in the examination and diagnosis of simple cases. So at least there is an effort to provide a physical examination, a distance physical examination to the patient. Financial information. The cost of the ENT endoscope in the online seller, 300 pesos. The cost of ENT endoscope delivery, depending on the radius from the ENT's place of work, 100 to 300 pesos, depending on the radius again. Cost of teleconsultation can range from anywhere between 800 pesos to 2,000 pesos. So in total, the total cost of the package could range from 1,200 pesos all the way up to 2,600 pesos. That's my 7 slides. These are my sources. Thank you very much for your attention.
Thank you, Dr. Maria Rosa Santos. The next presenter with the title Determination of the Compliance Rate on the Clinical Pathway Using the Quality Performance Measures for Patient Undergoing Coronary Artery Bypass, Grafting, or CABG in a specialized cardiovascular center in Quezon City. May I call on Dr. Francois or Franz May Sarmiento.
Healthcare institutions use clinical pathways as a means to promote quality improvement as part of its total quality management strategy. In our center, we started to use clinical pathways as a tool to continuously provide the best cardiovascular care and to ensure that the care we are giving are at par with the global standards by translating internationally recognized clinical practice guidelines into the hospital process of care and evidence. This study aims to determine if our center is utilizing and complying to the operational processes of the clinical pathways, specifically the standard risk CABG or the coronary artery bypass graft surgery clinical pathway. This is to ensure that the goals of the use of the clinical pathways can be achieved. A total of 107 clinical pathways of patients who underwent coronary artery bypass graft surgery from January to November 2020 was included in this study. And the results show that the compliance rate of the use of the standard CABG surgery clinical pathway was 71.5%, which is a satisfactory rating. Currently, we cannot compare this rating as we do not have a baseline data for this compliance rate, as this is the first study to report this index. The regression analysis showed a value of 0.89. This validates that there is a positive correlation between the operational efficiency measures and the length of stay of the patient. And this assumes that a rate of 71.5% compliance to the clinical pathway, that there is a satisfactory compliance rating for the clinical pathway being used to patients in our institution. The length of stay is mainly determined by the operational efficiency measures. Particularly of great influence is the length of stay in the ICU post-operatively. And these are my references.
Thank you, Dr. Franz Sarmiento. The next presenter with the title Expansion of COVID-19 Testing in Targeted Community Using the Rapid Antigen Test. I call on Jemrick Justin Te.
Good afternoon, everyone. I'm Dr. Jemrick Justin Te, and I'm here to present my project paper entitled Expansion of COVID-19 Testing Program in a Barangay Health Center in Makati using the Rapid Antigen Test. Okay, the first human case of COVID-19 was reported in December 2019 in Wuhan City, China. And by January 30, 2020, COVID-19 was declared as an outbreak by WHO. It was also around this time that the first case was reported in the Philippines. By March 11, 2020, WHO was classified COVID-19 as a pandemic. The Philippines, being an archipelago composed of more than 7,000 islands and a population of more than 110 million, faced roadblocks early on as logistics and medical resource availability made it difficult for majority to have access to the tests and treatment needed. With a few labs able to perform their RT-PCR test, initial reported cost of the RT-PCR test was between 5 to 10,000 pesos in private hospitals. So I'm currently part of the Barangay San Lorenzo Health Clinic in Makati. So initially we had this program implemented September 2020. The program was to provide residents an option for COVID testing. It was subsidized at 850 pesos, done every Monday morning and Friday afternoon. It allowed the local government unit to identify, isolate, follow-up contacts, and care for patients early. It also helped decongest testing centers, especially in times of expected surges. So an example of our barangay poster. So with the recent recommendations from the Department of Health allowing the use of rapid antigen testing as confirmatory and diagnostic augment for COVID-19, especially in certain targeted areas, meaning your NCR plus area, including Bulacan, Cavite, Laguna, Rizal, and Metro Manila, with close contacts and COVID-19 suspects and probable cases. So we aim to expand our current testing program by increasing the number of days that we conduct swabbing from Monday and Friday to Monday, Wednesdays, and Friday, and to offer free rapid antigen tests, especially for those with symptoms and known close contacts. Rapid antigen testing is relatively inexpensive and can be performed outside of the hospital. Turnaround time of around 15 to 30 minutes. Advantages are, again, cost-effective, used for targeted screening for suspects with direct contact, communities with high positivity rate. The disadvantages are, it is not recommended for mass screenings, for work clearance, and for those with low level of suspicion. So just to share, this is our basic rapid antigen test setup. So this is the test kit that we use. That's all. Thank you.
Thank you, Dr. Jemrick Justin Te. The next presenter with the title in Awareness, Perception, and Apprehension of Medical Health Worker Toward the Coronavirus Disease, COVID-19, Pandemic at Tertiary Government Hospital. May I call on Dr. Nino Bernardo Tembungco.
Good day everyone, I am Nino Bernardo V. Tembungco, a student in Master in Management, major in Hospital Administration, and I will be presenting awareness, perception, and apprehensions of medical health workers towards the coronavirus pandemic in a tertiary government hospital. Coronavirus is a zoonotic pathogen that can be transmitted via animal to human and human to human interaction. The current outbreak of coronavirus disease was first reported in Wuhan in December 2019. The disease defied geographical boundaries with epidemic size doubling every 7.4 days. On the 28th of January 2020, the first case of COVID-19 was reported in the Philippines. Since then, there has been an exponential increase of cases. This pandemic situation has applied unprecedented levels of workload and pressure to the medical health workers. This paper aims to explore the risk perception and the fears of medical health workers towards this time of pandemic. Likewise, it also aims to define the approaches to alleviate the fears of medical health workers and if the vaccine provided them security during the pandemic. And these are my research objectives. This is a questionnaire-based descriptive study adapted from the study of Ogloda et al. That will be conducted among medical health workers in the tertiary government hospital in Quezon City. The content validity of all items had a score of more than 0.6 using an IOC analysis. There are 33 questions divided in 5 sections, assessing the socio-demographic variables, the participants' knowledge about COVID-19, the risk perception and attitude of participants towards COVID-19, and the fears of healthcare workers as regards COVID-19 pandemic. For the results, the study analyzed a total of 100 participants who completed the questionnaires. The majority are within the age group of 31 to 40 years old at 45%. A more significant number of participants were females at 62%. Among the participants, 62 were consultants, 26 were nurses, 25 were resident doctors, 13 were nursing aides, and 4 were secretaries. and all were completely vaccinated against COVID-19. A more significant proportion of participants strongly agreed that the spread of disease could be prevented by wearing face masks, social distancing, lockdown or stay at home, and environmental sanitation. With regards to the treatment outcome of COVID-19, although a more significant proportion of participants, 69%, said that the disease could be treated, there are still 29% said that once infected, death is imminent. With regards to the risk perception of healthcare workers towards COVID-19, 95% perceives themselves at risk of being infected by the virus going to work these days, and all of the participants believe that they are prone to having the infection. Majority of the participants agreed that their willingness to go to work had been affected by the COVID-19 pandemic. Only 20% of the participants strongly agreed to attend to COVID-19 patients even adequately compensated. In terms of fears of healthcare workers regarding COVID-19, 10 and 22% strongly agreed and agreed respectively that workplace safety is adequate. Most of the participants, 71% combined, strongly agreed that the lack of social insurance policy for healthcare workers was an obstacle to effective service delivery, especially in this pandemic period. Out of 100 participants, only 6% strongly agreed that the hospital infection control policy was adequate. For the discussion, coronavirus disease is one of the major problems at present, not only in our country but also in the entire world. All participants in this study had received 2 doses of COVID vaccine and belong to the young adult group. It shows that health workers are still young and will be able to serve several years more in the hospital and are somewhat protected from COVID-19 because of the vaccines received. Although a more significant proportion of the participants believe that coronavirus spread could be prevented, all participants believe that they were prone to infection. These apprehensions were attributed to the Delta variant of COVID-19 that was in existence during the time this study was conducted. In this study, all of the participants were fully vaccinated, and vaccines are said to continue to reduce a person's risk of getting the virus that causes COVID-19, including the Delta variant. However, according to CDC, the Delta variant was more infectious and was leading to increased transmissibility when compared to other variants, even in vaccinated individuals. This contributes to the reason why the majority of the participants continue to perceive themselves at risk of being infected by the virus going to work these days. The coronavirus disease and its related death of threats had led to significant fears among health workers and their families around the world. Among the many valid reasons are fear of developing the infection, fear of failing to provide adequate care for patients given limited resources, fear of carrying the virus home and infecting family and friends, fear of stigmatization, and many others. These studies show that medical health workers' apprehensions toward COVID-19 is accentuated by inadequate workplace safety and inadequate hospital infection prevention and control policy, which is the same situation when this pandemic starts. Lastly, these studies show that majority of the participants believe that COVID-19 infection is treatable. However, a significant number of participants consider that death is imminent once infected. Working in an environment like the hospital makes the risk of contracting the virus level higher than for any general public member, since they are likely to contact infected patients. This concept explains the unwillingness of medical health workers to attend to COVID-19 patients, even if they are adequately compensated. For the conclusion, medical health workers have the same level of apprehension and anxiety as when this COVID-19 pandemic started. Vaccination offers a minor effect in alleviating medical health workers' fear. There should be provision on adequate workplace safety and hospital control and prevention policy and an excellent social insurance policy. Thank you.
Thank you, Dr. Nino Bernardo Timbungco. The next presenter, work-related ocular foreign body injuries, a prospective multi-center study, Dr. Neil Viloria.
Good afternoon. I'm here to present my paper with the title, Work-Related Ocular Foreign Body Injuries, a Prospective Multi-Center Study. Ocular injury is a leading cause of visual impairment and has a significant impact to the individual, healthcare system, and community. Studies have shown that ocular foreign body accounts for the majority of eye injuries. The epidemiology of eye injury has been well described in developed countries. However, despite eye injuries being a common cause of ocular morbidity and an important public health concern, the data in our country is limited. This is a multi-center prospective study which will be conducted in a tertiary government hospital. All patients that will be seen at the emergency room and the outpatient department has ocular foreign body for a 12-month period will be included. A verbal consent will be obtained. Data forms were designed to collect the following informations: patient's demographics, educational attainment, presenting complaints, visual acuity, diagnosis, and management. If the injury occurred at work, questions will be asked regarding the nature of their work and number of years of work in that profession. When the person used eye protective device, further questions like regarding the reason for not using them are coded as free text answer in the data form. The type of foreign body will also be noted. The affected eyes, and the location of the foreign body will be determined. Availability of clinic facility within the workplace and initial intervention will be asked. Time interval between injury and presentation at the hospital and number of previous similar injuries will also be included in the data form. For all cases, the ophthalmology resident or consultant will obtain the history, perform a complete ocular examination, and provide treatment. Summary statistics such as frequency and percentage and mean and standard deviation will be used to describe the general and clinical characteristics of the patients who presented to the ER and the OPD with work-related foreign body injury to the eyes. All valid data will be included in the analysis. STAT-812 will be used in processing. They will be used in data processing and analysis. The epidemiology of eye injury has been well described in developed countries. This study is important because it provides data from a developing country like the Philippines. The study focused on OFB because it is the most common eye injury and is also easily preventable. The strength of this study is derived from the fact that this is a prospective and multi-centered. This eliminates the possibility of inadequate documentation and the problems of retrieval commonly seen in studies which are retrospective in nature and based on coded hospital discharge data. The current study is, however, limited by its relatively small study size, attributed to the short study period. As an ophthalmologist, we should be active in promoting the concept of prevention of eye injuries, assessing the patient's eye injury potential, and prescribing the most appropriate protective eye device. We also recommend the establishment of database of all ophthalmic injuries to aid research and development of new preventive strategies. Thank you.
Thank you, Dr. Neil Beloira. Thank you. The last presenter.
Are you okay?
Okay.
Okay.
The last presenter, with her title, The Impact of Coronavirus Pandemic COVID-19 to Healthcare Worker, Mental Health Employee in Private Companies, Manila. May call on Rachel Stephanie George.
Welcome. I am Ms. Richelle Stephanie George, and I will be presenting my paper on the impact of coronavirus pandemic, or COVID-19, to healthcare workers' mental health employed in private companies in Metro Manila. Coronavirus disease 2019, or more commonly known as COVID-19, is an infectious respiratory disease which is caused by a newly discovered strain of coronavirus. Persons who are infected experience mild to moderate pneumonia, and most of the patients will recover without medical treatment. However, for older people and those with other comorbidities like cardiovascular disease, diabetes, chronic respiratory disease, and cancer, are more likely susceptible to develop serious illness. The World Health Organization declared COVID-19 a pandemic in 2020 of March, pointing to over 110 countries and territories around the world where coronavirus disease was present. Any kind of infectious disease that causes pandemic outbreaks, namely COVID-19, as well as other concerning public health events, causes different forms of emotional distress and anxiety. These feelings, such as distress and anxiety, can occur even to people that are not sick. In addition to the direct impact of the pandemic, numerous studies have already reported that medical staff suffer mentally from this pandemic. For example, those in South and Southeast Asian countries, there were noting of psychological problems among staff in the hospital due to high workload and intermittent lack of protective equipment such as PPE. Healthcare workers could be in need of support from their superiors and organization leaders to check and assist on their mental health needs and in time of this global health crisis. The goal of this study is to explore and critically analyze the impact of COVID-19 pandemic to healthcare workers' mental health employed in private companies in Metro Manila. The retold life experiences discuss their feelings, experiences, and thoughts on what they do to cope in every situation and identify if proper support is accessible to help them keep their mental health in check. Prior to the pandemic, healthcare staff were already prone to experience burnout, thus having an elevated risk of suicide, substance abuse, and other signs of mental distress. The condition was aggravated due to high volume of staff resignation, doubled workloads, extension of working hours, recall and missing out rest days, and reassignment to different areas. Healthcare workers could not decline work area assignment in COVID-19 ward, while some work on areas where patients' COVID-19 status is not checked or confirmed. Some have their own style or ways on how they feel safe and keep themselves protected from the virus, and those in common are ensuring to wear complete PPEs, frequent hand sanitation, limiting contact to services and patients if possible, prayers, adhering to institutional safety protocols and guidelines, and changing of uniform to regular clothes. Healthcare workers commonly felt fear of contracting the virus and bringing to their family, as well as the possibility of being away from their home in cases of need to quarantine for confirmed and possible exposure to COVID-19. While on the long term, some expressed fear of dying or of a family member from the disease since the risk of exposure is very high and there were times of shortage of proper PPEs. It is evident that COVID-19 pandemic affected the mental health of healthcare workers during this time of crisis and challenging working conditions. Thus, it is important to prioritize and protect the mental health and well-being of healthcare workforce. Administrators, leaders, and the management of healthcare facilities can look into how people working in the health facilities be supported and given access to mental health measures, such as counseling, consultation with a professional practitioner for mental health, promoting supportive work culture, permissible and appropriate activities to boost morale, and even simple recognition and appreciation from the superiors. Thank you.
Thank you, Richelle, Stephanie, George. Doc Matt, I would like to introduce to you the 27 student from Master in Management major in Hospital Administration. Thank you, Doc Matt.
Thank you so much, Doc Index. So we have heard the presentation of the candidates for our Master in Management major in Hospital Administration, MMHoA. So please hold on to your questions, queries, observations, general or specific towards the presentations. Later on, we shall have our short open conversation with our presenters. For the meantime, let us proceed to the next cluster. May I call on Dr. Ronaldo Poblete to introduce us to the group Master in Management, Major in Crisis Management and Disaster Resiliency. Good afternoon, Doc Pobs.
Good afternoon, Doc Matt. It is my honor to present to you the 4 students of Master in Management, Major in Crisis Management and Disaster Resiliency. allow me to share the slide of the first presenter. The first presenter is none other than Engineer Joseph Michael Javier and Architect John Bernard Alejo. Their project study is entitled Assessment on the Creation of an Office of Crisis and Disaster Management in the Armed Forces of the Philippines. Okay.
I'm Architect John Bernard Alejo, and my partner is Engineer Joseph Michael Javier. We're here to present about the assessment of the creation of a command in AFP for crisis. The creation of the Office of the Crisis and Disaster Management of the AFP is necessary to have a more focused and resilient response in addressing all types of crises and disaster in our country. Foregoing the research may at least contribute articles how our government is addressing crises and disasters. The approach of the research would provide perspectives, and that being a third world country with holistic approach by the appropriate agencies, such inevitable casualty, damages, destruction, and the like as a result of crises and disasters would either be prevented or avoided or minimized. The objectives of the research is to provide a substantial knowledge why the AFP is the appropriate agency to become the center of command for crisis and disaster management. It is also to introduce as a recommendation for the creation of a new command under the organization of the AFP. Also, we are here to discuss disaster events and differentiate how the country address it by using the current management we have. The purpose of the importance of this research is to focus and develop appropriate approach for the integration of an office or department command for the crisis and disaster management. Also, it is to develop an initial foundation for organization and creating efficient structure that integrates ICS basic command structure for the office or department that will be created. Also, the findings of this research, years counting disasters like typhoons and other disasters, the research observed that the country's crisis and disaster management has always been a trial and error in terms of doing an action plan from pre-disaster and post-disaster operations. For the case of the Interagency Task Force or the IATF, the current office who manage the crisis of the pandemic, most of the plans are not successful in planning, but in application, some national and local governance failed to implement. Thus, they are implementing improvised plan, which is beyond the policy given by the IATF. Also, this study provides valuable insights and tools to help leaders effectively navigate respond to this crisis. As an introduction, the Philippines, being an archipelagic country having more than 7,100 islands, experiencing more or less 20 typhoons, volcanic eruption, and earthquakes annually, enough to say that this country is challenged every year with natural and man-made disasters. The emergency preparedness of the Philippines was introduced by the original to 1941 when President Manuel L. Quezon created the Executive Order or the 825, established the National Emergency Commission and implementing measures to control and coordinate civilian participation to meet serious crises. And as the research rationale, the past delegated to the OCD or the Office of the Civil Defense, composed of civilians with appropriate skills and trainings that is deemed would suffice the requisite in performing the duties and responsibilities of an agent of national disaster and risk reduction management. The NDRRMC, in cooperation with the AFP and other uniformed civilian services, are addressing and responding in all kinds of crisis management situations, more particularly on national calamities. However, the execution of the crisis disaster management has always been people or authority that intervene and insisting their skeptical weight of addressing matter at hand. Hence, the streamlining of services are greatly affected, worse, delineated to non-essential or impractical output. Then the problem of the research or the statement of the problem, the research project aims to achieve that the crisis and disaster management would be better administered and managed by the well-versed or experienced centralized organization that has been practicing crisis management over the years. The problem includes requirements
Sorry, the Pobs, unmute. No, maybe you can unmute yourself. Unmute ka, Doc Pobs. Doc Pobs.
Yes, Doc.
On our next slide.
Unmute please. Walang sounds. Ikaw ang unmute. Mag-unmute ka.
Well-trained military officers.
Thank you.
Proposed integrated offices that will cater crisis management is included. Here we integrate the ICS or the Incident Command System under the organization that we are proposing to be created under the special staff. Here is the Office of the Crisis and Disaster Management. It has its own admin, intelligence, operation, logistics, planning, communication, civil relation, and training. And the other hierarchy we should integrate is the Army. We should have its own research and rescue battalion, crisis disaster preparedness, surveyor and assessor, civil relation, technical administrative, engineering combat, and mobility battalion. And LGUs, NGOs, and government bureaus should follow under this hierarchy. The project design also includes the executive order by the commander-in-chief. An executive order by the president is necessary to give mandate authority to the chief of crisis and disaster management through the chief of staff, AFP, the command over respective government and non-government agencies during the times of the crisis and disaster. And here we concluded that the researchers' primary objectives on this proposition is to give emphasis for a more serious and strategic approach in a holistic manner the way this country is addressing crisis and disaster. Since up to the present time, the government, more particularly the LGUs and other bureaus, fight both ends meet, especially when self-interest interferes, be it political or societal, hence prompt and efficient delivery of services is compromised, and as a result, victims suffer more than what the crisis have resulted. Having said that, the military has been always the best player or solver in handling pressure and catastrophe. Therefore, the creation of Office of the Crisis Disaster Management under the AFP to administer and manage country's battle cry to at least reduce the casualties and property disruption caused by disaster, may it be a man-made or natural calamity. Therefore, crisis and disaster management is better addressed by the AFP. If you have questions, just let us know, and here's our reference if you want to know about our researches.
Okay, allow me to proceed with the second. Okay, the next presenter is Ayan Jasmine Decano. Her project study is entitled An Assessment of the Capacity of the Local Government of Santa Maria, Ilocos Sur on Disaster and Risk Reduction Management in Times of Pandemic.
This project study is about the capacity of the local government of Santa Maria, Ilocos Sur, on disaster and risk reduction management in times of pandemic. Local government, which are considered to be the core of community. A local government unit remains before and after disasters, as mandated by the Local Government Code of 1991. This programs government in it will bring out what crisis is and the extent of its impact to an organization. In this study, the efforts of the local government body will be measured and described and how it manages different types of adversities by the programs they are implementing. All in to showcase the local government unit's good and contribution to the advancement of the general welfare of its own people and the sustainable programs they plan to maintain and improve. This study will measure the strength of the link between the local government unit to its grassroots level officers and other non-government organizations involved. Local risk, local risk, strategy and reduction actions, and recognized by this study. Additionally, the study will help the of stakeholders to know various preventive crises, fit for their organization and the situation, and make policies that can reduce crises which hinder the attainment of their local community development. The literature review for the local studies of this research came from Professor Joel Yuenco of e-training on his early warning, early action, and from Ms. Claire Balde of NEDA on her speech regarding Build Back Better programs of the government in the previous disasters. To conclude, this study will assess the local government's capacity to organize for disaster resilience concerning plan making in compliance with the national law, coordination and participation with appropriate authority and resources to address disaster risk reduction, and the integration of resilience with other vital functions of the local government unit. Disaster risk reduction has become a major area of concern in the wake of increasing numbers of disasters. Risk management has also been the ongoing and widely publicized having roots in its erroneous implementation. While considering the valuable role of the risk management, it is also essential to understand the many circumstances in which risk management the province of Ilocos Sur can inform the development of effective DRR mainstreaming tools in other small towns reliant on external support. And here are the references for this study. Thank you.
Okay, our next presenter is Ariel Medal Puy. His project study is entitled Importance of Risk Assessment in Construction Work.
Hi, all this is Ariel Puy, taking up hazard management, crisis management, and disaster resiliency. Today I'm going to present the project seminar presentation entitled Importance of Risk Assessment in Construction Work. This assessment is part of safety code of practice. It's aim to assess the reasonable activities to reach higher level elimination, substitution, engineering control, administrative control, and PPE. And is considered to one way to reduce, control, and prevent or reduce likelihood any impact of an accident that may occur prior and during execution of work. The requirements of this assessment applies to all work activities where there is a risk of significant injury, ill health, property equipment damage, and fatality. Wherein, it helps identify hazard and risk, including the precautionary measures that fits proper implementation in order to reduce the risk impact and to comply with the health and safety code practices. The full and strict implementation of the risk assessment requirements will also help the company and the project to avoid production loss, financial loss, time loss, delays, property damage, loss of life, and injuries. The risk assessment also aims to reduce the occupational injuries incident and thus ensure in different industries. That's includes but rather about identifying sensible measures to control the hazard of this in the workplace. These assessments are very important as they form an integral part of my occupational health and safety management plan to ensure all the safety of the employees, workers, and the public prior and during work execution, in which they have to create awareness of hazard risks, identify immediate risks, determine whether a control program is required for a particular hazard, determine if existing control measures are adequate or an additional shall be required, prevent injuries or illnesses, especially when done at the design or planning stage, prioritize hazard control measures, meet the legal requirements as either mandated by laws or any other procedure where it is applicable. The failure of this assessment implementation is once again proven. Based on the incident report that occurred in UK, Red Hall Engineering Services titled Failure to carry out correct risk assessment leads to two workers sustained serious injury. It was published and written by British Health and Safety last 12 of July 2018. This only shows how important risk assessment is, not only in construction industry but also in other types of businesses as well. We may not totally eradicate the hazard risk, but it can surely control and reduce the possible negative impact to avoid the possible losses, either financial or the loss of human life. That's all for my presentation. Thank you very much. Hi, to all this is Ariel.
Thank you.
Okay, Doc Matt, that would be the end of the presentation for the crisis management and disaster resiliency. Thank you, Doc.
Thank you. Thank you so much, Doc Pobbs. And we have one presentation from Doc Santos. Go ahead.
Allow me to present the title Communication Skills Training for Clinical Staff of Tertiary Government Hospital Amidst the Pandemic by Dr. Carlo Nov28, MD. May I call on Dr. Carlo?
Good afternoon, everyone. Allow me to present my project proposal on conducting a communication skills training program for the clinical staff of a tertiary government hospital amidst the pandemic. The appearance of COVID-19 took everyone by surprise. With the number of patients requiring treatment, the healthcare system collapsed due to lack of hospital supplies and beds. Overwhelmed with the number of cases dealing with an unknown disease and the use of cumbersome PPE led to burnout of healthcare workers. Several international studies were done assessing hospital service quality during the pandemic, and results were conflicting. The majority reported a decrease in the level of patient satisfaction. Service quality is a measure of the extent to which the service delivered meets the patient's expectations. Previous studies have shown that rather than technical skills or hospital infrastructure, the most important factor in improving patients' level of satisfaction is actually the service attitude of the medical staff. An initial hospital service survey will be done to assess the current level of patient satisfaction, which will also serve as a baseline. Another quality assessment will be done after a quarter in order to gauge the success of the program. The online training will be composed of 4 parts. Current knowledge on COVID-19 and rational use of PPE will be discussed by an infectious specialist. The rest of the program can be handled by the Quality Assurance Department. Second part is to identify communication barriers due to COVID-19 safety protocols, like the wearing of face masks, which muffles the voice, covers facial expression, and lip movement. Physical distancing alienates the patients, while minimal interaction time gives an impression of being rushed. Possible solutions to these barriers would be moderating the tone of your voice, speed of your speech, use of a lapel microphone is encouraged, employing video chats, and utilizing nonverbal forms of communications like leaflets and flyers. Empathic communication will be discussed in the succeeding slides. For practical applications, the participants will be encouraged to share their actual experiences in dealing with patients during the pandemic and discuss better approaches in communicating. The empathic communication will be patterned after the Cleveland Clinic's recommended approaches to show empathic responses. The READY model emphasizes on how to establish, develop, and engage in communication. Hard to communicate model starts with heart by smiling, identifying yourself, active listening, building rapport, and thanking the person. When handling difficult situations, respond with heart. Hearing or listening to the patient's situation, empathize with their position, apologize if there is a need, respond with assurances, and thank them. The proposed communication skills training program is an expensive way to correct the problem of decreasing levels of patient satisfaction. Owning their communication skills will improve the service attitude of medical staff towards the patients. Being the most important factor in patient satisfaction, this will directly address the root of the problem. This project can be expanded to include other hospital staff with direct interaction with patients and can be included as part of the orientation program for new employees, especially now that the medical and nursing students' clinical rotations have been converted into online learning during the pandemic. These are my references, and thank you for your attention.
Thank you, Dr. Carlo Nov28. Take it back.
Thank you so much. I think Doc Carlo made a spot on to end our presentation, the heart. Okay, so thanks for staying with this activity. We have reached as far as 120 plus participants. So we are almost on our last juncture, which is on a short conversation. So we may raise our hand so to be acknowledged. If there are some general or specific comments, observations, queries, or questions regarding the presentation of the two groups, the Master in Management in Hospital Administration and Disaster Resiliency. Doc Eileen is raising her hand. Good afternoon, Doc.
Good afternoon, Doc
Good afternoon.
Matt. First of all, thank you, Doc Matt, for patiently guiding us. We're almost finished with the Masteral, and to Professor Endix, thanks as well. My question po is not necessarily a question, maybe a clarification from Miss Leia Sardena. I heard when she presented that she said it's a quantitative phenomenological approach, her paper. So I'm just wondering, like, because we know that phenomenological design is basically qualitative, can she enlighten us, sir?
Yeah,
Thank you.
yeah, okay. So if Rhea is here, Nurse Sardena, yeah, I think we have to clarify on methodology. I would like to say something that your presentations may somehow at the moment broad in nature, because our instruction really in our classes, no, throughout this program, that there was a constraint in the gathering of data. So we advise, we had somehow an agreement or a negotiation that we can test our instrument in a pilot way, no, just small, so we can somehow go into the process of the scientific inquiry. Dr. Eileen's observation, I think, is valid. So in the methodology used, that is phenomenological and qualitative in nature. So how is data treated in a quantitative yet qualitative in approach? Do we have Leah? Is Leah around?
Ako na lang
Okay,
mag-cascade
go,
sa kanya.
Doc.
Ako na mag-cascade dun sa question ni Dr. Eileen.
Okay.
Maybe the question is very valid, no? Maybe baka it is not a phenomenological but is a mixed method, no? Pwedeng peno and quantitative. No? Baka yun ang the question on the methodology. Different yung phenomenological. It is a team, no? Kinukuha mo yung team. Yung sinasabi, live experience ng mga respondent mo or co-researcher mo. So mukhang wala siya sa chat box, wala siya sa room. Maybe I will cascade the information to her. Thank you.
Yeah. So it's just a choosing appropriate approach in
methodology.
So quali is more of building a theory. So you're right, no? Looking at qualifying, no? So to create a construct or the themes, no? From the most likely, no, lived experiences of the participants. And phenomenology is about discovering meaning to construct. So I hope we have addressed the concern of Dr. Eileen on that. No? So we will cascade that to Ms. Sardena. And I hope personally, no, observing the presentations of the first batch, that was really good job, no, for our constraint of time when we started developing our projects, our researches. And we hope, as mentioned in our last yesterday's activity, that we can put together maybe collaborative work, no, for those participants around here, so we can really publicly disseminate our outputs, no, through publications, and maybe improve, polish, and as mentioned by the presenters, more data, no? More inclusion of data, so it
may question dito, Doc, from Manuel,
Prof.
for the
Manuel,
medical doctor.
For the medical doctors, do you see a continuance on the use of online medical consultation even when everything is back to normal already? Can any medical students would like to answer that?
Sir, yeah. Good afternoon po again. I think, sir, in the presentation, my observation lang in the presentation of the yung use of teleconsultation, I think we it parang mas maganda is to identify the challenges of the use of teleconsultation or the use of telemedicine in the setting now. more than its efficacy, more than its the acceptability of the patients. I think what is significant is to identify the challenges with regard to the patients, challenges on the so doctors, and of course challenges faced by the hospitals, because we know that it isn't like a subjective thing, like it's not a personal teleconsult. But again, if we will do like an outpatient teleconsult in Bulacan Medical Center, my question actually was it provided by the outpatient department of Bulacan Medical Center, or doctor the Dr. Katindig was referring to, like a teleconsult by private practitioners lang using their own cell phones, their own numbers.
Yeah. Doc Katindig would like to elaborate on that. I think when we had our consultation on his proposal, we look into looking at the infrastructure, no? The technological administration, whether there is capacity and ability in terms of putting that, no, as a platform, telecommunication, teleconsultation. And I think if doctors would say, will this continue when we approach post-pandemic? Would the approach would still be effective? I think we have people here raising their hands. Doc Danilo, Doc Alex, yes. Go ahead.
Yes, sir. Good afternoon, Dr. Kabungkal here. Before the pandemic, the Batangas Medical Center, which is the DOH retained hospital in Region 4, has started a project called Telehealth. So this Telehealth is when we see patients through telecommunications, through cameras in remote areas of Southern Luzon, Region 4. So we have patients in Mulanay, yung mga hindi masyadong napupuntahan. And then this pandemic happened, so na-expand na lang namin. Actually, since the Batangas Medical Center is a COVID hospital, so we stopped most of our operations and focus on COVID. So our outpatient department, the whole of the center, resorted to online consult. And since we have learned a lot on this platform and we see some advantages, kasi just in our case, the ENT department holds consultations until 9 p.m. So it is convenient for people who who has no time to go to the clinic or to the hospital kasi yung work hours nila is not convenient for them to the usual 8 to 5 consultation. So I see that we will still continue to have this platform and maybe enrich more on how we deliver the services. So that's my take.
Parang LMS.
Sir.
Doc Danilo? Thank you.
So
thank you.
if we will stick with the question,
yes,
I think the telemed consultation will continue even post-pandemic, but there will be refinements. There are known specialties which you can conduct through telemed. One is allergology, second is dermatology. Kasi pwede yan eh. You just have to visualize, you just have to listen to what the patients say. However, there are some specialties with delimiting factors like ophthalmology, ENT. How can you remove a fish spine in the throat if you will not see the patient? So in other words, we need a lot of refinements. Buti kanina may pinakita si Dr. Santos, a possible refinement of ENT consultation so you can visualize the cavities. So it is much, it is much convenient for the patient, more for the patient than for the practitioner. However, I think it will persist even after post-pandemic. But I, for one, I do not do telemed because I want to be very sure with my findings. Thank you.
Okay. Do you have some additional, Doc Dan?
Can I have the floor?
Wala na po.
Okay. Sure. Doc Gutierrez, good afternoon.
answer Dr. Laksamana's
Okay,
query.
sorry. Yeah,
Dr.
I
To answer Dr. Laksamana's query about telemed in Bulacan Medical Center, I'm also connected with Bulacan Medical Center, although I am a volunteer doctor. But those consultants with item are required to do telemed, and they have to report in the hospital at least twice a week. But they do teleconsult. In Tondo Medical Center, which is I'm also a consultant. What we do there is the hospital provides the what's this, the yeah. But the residents are the one answering the what do you call this, the consultation from the patient. But the consultants are required to have a teleconsultation once a week, just to comply with their 20 hours duty. No? So one day of teleconsultation, one day personal face-to-face consultation, and pero yung ibang hours just to complete the working hours is they have to attend meetings or department meeting or MANCOM meetings. What we do in OFTA, although I believe it will continue even the pandemic is over, kasi the benefit of teleconsultation is it controls the number of patients going to the OPD. So yung lang pinapupunta sa clinic are the one na hindi talaga hindi pwedeng matingnan sa camera lang. Pero other eye diseases are being seen through the camera, yung mga external eye diseases. Pero kung kailangan yung mga refraction, error of refraction, visual acuity, at saka mga fundoscopy, they are advised to go to the clinic. So yun lang control of the number of patients. Malaking halaga na yun para hindi mag-congest sa OPD. That's what we do.
Okay, so thank you so much, Doc Gutierrez. I think if I can make it into a parallel analysis similar to our circumstance, professors, the academe. So we use LMS now, learning management system. So we adopted a lot of platforms by depending on the university. But now the question of teachers or the general students, stakeholders, administrators, whether to continue with this kind of platform in the post-pandemic, I think the answer is also yes. Now, similar to your case, and I think I may look into Dr. Laksamana's view, that if we continue with our research endeavors, so we may look into not on the implementation at this stage, but on the effects, on how it is affecting, for example, in learning, teaching approach, the students, the teachers, and the administrators. Most likely infrastructures are already there, technology are already set up. So I think what is more relevant is knowing whether it has an effect and whether it has impact on the learning and the teaching strategies and knowledge with respect to the students. And also on the area of whether it is whether it occupies a certain area on the infrastructure, the investment on infrastructure. Somehow there are really gaps in terms of making it objective, kasi sa mga nangyayari ngayon, talagang connectivity cannot be objective, cannot be put into objective thing, because it depends on the users. So I think we have the same scenario with the case ongoing on to continue with our interests on teleconsultation. So maybe we can adopt some of the suggestions here that we look into the effect, the effect or the impact in the post-COVID scenario when we pursue our papers later. Okay, any other questions here? Okay, so I think most of the comments here are congratulations to the graduating class, the presenters. So they have, I think we have learned a lot, and then the young ones have really seen how our first batch have went through the rigor of thriving research and putting up the project. So congratulations to all the graduating class. So we have almost done in terms of presentation. We also congratulate for your comprehensive exam. So there's only one thing that we shall await, our graduation. So would there be any other questions?
Sir?
Yes.
Talanay?
Hold on.
Talanay, sir.
Okay, Doc. Yes, Doc Deo.
Sir, comment lang.
Yes.
So, I think everyone agrees na case-to-case basis ang sa medical consultation. So, hindi lahat pwede. On second thought, ibabalik ko yung question, sir, regarding the online learning. Will you be retaining the online learning, which is after the lifting of everything? Kasi I find it advantageous though, but disadvantage on different aspect. Pero what do you think, sir? What about
I think that is the one thing that I missed in the comment of Doc Eileen. So looking at which area, which specialization that teleconsultation would be more effective. So I think that's another area of research, just like the online learning that we have in the academe. So we look into specific courses, courses na ma-apply ang online learning. Now, for
similar,
me personally, I'm teaching social sciences. So it's practically online is more appropriate than those teaching with laboratories. And then we have Doc Endex here, which is our director for University of UMAC, UMAC for our LMS to say something.
Hindi, actually yung hindi pa pandemic. Problema na nga yung 1:50 ratio. One teachers to 50 student. With this, the technology ng LMS medyo mababawasan. Similar with the hospital dahil sa dami masyadong punuan sa I think the telemedicine will also address to that particular problem. Yun lang, Doc Matt.
Kasi sir, I find it advantageous on some aspect yung online learning, especially yung travel, traffic, the congestion and everything. Though may applicability din yung face-to-face learning. So I think magiging applicable din yung online learning at the moment, sir. Siguro. O pwede ring i-adapt regularly sa ibang classroom.
Yeah, Doc Deo, I totally agree on your observation kasi I have dual citizenship in teaching. So I have also been a long way in the distance education. So I believe on distance education, and I also believe in traditional education, which is the face-to-face. So there are a lot discovered now, appreciation ng mga traditional na appreciate na yung konsepto ng distance. And I think one requirement really, I think even us, kung sa inyong side, ang distant talaga na communication or consultation man yan, no? It takes a lot of maturity. It takes a lot of, kasi independent. No? So,
acceptance din.
Subjective because you need to have a certain level of compliance sa technology, something like that. No?
And refinement.
It can really weigh down cost, no? Doon sa ibang bagay. And multitasking can be much more, accomplished, right? So,
and sabi nga nila, sir, di ba, the most precious thing in this world is time. So with this online learning, parang even though hindi mo kailangan magbiyahe ng matagal, kahit nasa kabilang dulo ka ng daigdig, makaka-enroll ka anywhere, makakapag-aral ka anywhere. It's not simply multitasking, but saves time and money at the same time. Diba?
Yeah.
So na ma-maximize mo yung time constraint na meron ka. But in fact, before, yung face-to-face, you have to present yourself dito sa country na ito, and be there, enroll, and at any rate, they can really evaluate naman yung credentials mo for you to be accepted, to be enrolled, di ba, sir?
Correct.
Yun lang, sir. Yun yung nakita
Arlo,
ko.
tumabi ka para makapark ang daddy.
Correct.
Advantage nung
Tingnan niyo kung saan tayo nakapark. Baka
And I
makalimutan
appreciate
natin. Si
busy yata yung iba, sir. Thank you, sir. Thank you.
Salamat, Doc.
Thank you, Doc Lea.
Doc Index will take note on those shared observations.
Yes.
Do we have other comments or observations, suggestions, especially to the next batch? So this is our time to ask our first batch the questions.
Na-challenge sila.
I think we will end this with a general question na lang, no, doon sa lahat ng cluster, including this disaster resiliency class, no. We can have one or two to speak about, no, ano ang challenge along the way doon sa paggawa natin ng project. So I think we mentioned that in the other groups, no. So maybe we can start with the group on disaster resiliency group. Ano bang challenge? Kasi we have seen your proposals, no? It really needs a lot of collaborative effort, no, in the agencies na nandun kayo, AFP. So most likely, no, ano ba ang challenge doon? Can we have students from the disaster group? Architect Alejo, Puy.
Hi, Doc.
Yes, good afternoon.
Good.
Oh, maganda yung presentation ng
Good afternoon.
Ay, hinahanap kita, Puy. Sino ba to? Yes. Hello.
Si Ariel.
Ariel, sige.
Si Puy, si Miss Dicano.
Dan. Okay. Architect Alejo, go ahead. Ano ang challenge doon?
Ayun po, the challenges is ang dami
find a good place. We can hear you, John.
Maraming ideas about ito naging Yeah, lang po.
Yes, go ahead.
Hello. Ito pa. Clear na ito ba?
Sige pa.
Medyo bad yung reception ko kasi dito eh.
Oo. Parang nasa palayan ka. Parang nag-harvest ba?
Wala po.
Okay, sige. Go ahead, John.
Yan po. Hello po.
Yan.
Ayun po, the challenges na encounter namin dito sa research namin is yung iba-ibang opinion ng tao, and lahat yung leaders kasi meron silang iba-ibang idea about sa preparation and the preparedness para sa emergency. And syempre, yung idea na yun is hindi nagtutugma sa iba't ibang ibang aspects ng ng event. Tapos ayun nga, since ang daming alpha sa labas, ang daming alpha leaders, nawawala na yung harmony ng command. Kumbaga, si ganito gusto ganito yung nangyari, then si ganito gusto ganito yung system na i-implement. Ayun, yun yung pinaka-challenges na face namin about this research. Iba-iba yung opinion. Kumbaga, walang single opinion na gusto namin makuha talaga na ganito yung pinaka-system na gusto nila. Kaso, yun nga, it's a political decision talaga.
Okay. But I hope you can pursue your interest, personal interest on your research, that disaster can be included in the curriculum of architecture. Okay?
Yun yung sa project na sa seminar ko. Pero
because that was a good paper, so maybe you can look for collaborators, no? Para
yun yung gagawin kong project pag pinursu ko yung strategic management.
Correct. Kasi na-lab mo na yung disaster program.
Kasi nung nire-research ko yun yung about that thing, ang daming countries na like Japan, they integrate crisis management sa architects nila and the engineers. Correct. Kaya sobrang ang ganda ng system nila kasi mismo yung builders, they have the knowledge of this crisis management.
Correct. So we look forward to that next level Jan. Architect Alejo. Thank you.
Yes.
Okay.
Thank you.
Thank you. Anyone? Puy? Last from the crisis management.
Hi, good afternoon, Doc.
Hi, good afternoon. Yes, Ariel.
So actually, one of the challenges, the same na-encounter ng iba, Doc, is yung data gathering. Most probably I have done the survey and through a questionnaires that I have prepared and submitted to different health and safety practitioners, which are not only in the Philippines but also internationally, most probably nasa Saudi. Then another thing is yung mga content, because we have different opinion and different, let's say, perception when it comes to the requirements of the risk assessment. Because on my own point, risk assessment is not only for the construction but also in all other businesses, including in the operation of rescue, disaster, crisis management. That's part of the planning stage. But one of the things that we are encountering sometimes, because especially in the field of construction, yung mga safety officers, some of them are not familiar with the risk assessment. That's one thing, because what they think of the risk assessment is the job hazard analysis, which is different. So yan yung one thing na medyo in our project right now, I'm always insisting the importance of the risk assessment, which I always, most probably sinasabi nga nila, masama daw yung ugali ko when they saw me as part of the contractor, because we are the consultant, because I'm always rejecting their documents, especially the method of statement, kapag kayong ina-attach nila is only a job hazard analysis, when in fact the risk assessment is very important, because we are avoiding any loss, especially the loss of life, because hindi natin may babalik yan. That's one thing of the purpose of the risk assessment, is to reduce the claim of life. Instead of a major incident, it could be, let's say, go to a minor, because I'm not telling that risk assessment is always the answer to avoid any losses or any incident, but at least we can, let's say, kung ang possibility is to claim of life, then we can reduce it to the minor injury. Yun yung pinaka-purpose, because we could not always eliminate incident in the workplace, but at least we can reduce it or convert it not to have a major incident at the site. So yun lang naman talaga, Doc, medyo iba-iba lang yung mga understanding namin when it comes to the risk assessment through all the survey na ginawa ko sa mga health and safety, especially here in the Philippines. So far, that's all, Doc. Thank you.
Thank you. I have heard you since day one of our classes. So your advocacy on really safeguarding, no? Kahit nasa negosyo ang construction ang setting mo, but still yung advocacy mo for a safe work, no? So maraming salamat doon sa ganong knowledge, no, na meron. So thank you Ariel. Okay, can we have one or two from the hospital administration to wrap up our conversation this afternoon? Ano ba ang challenge dun sa proseso ng... Yes, Alex, go ahead. Good afternoon. Doc Alex.
So depends on the paper kasi. Sa amin kasi ang survey is hospital based. So there is a lot of hurdles kasi you have to ask the permission of the medical director. If there is a research committee, you have to ask them. You have to submit your proposal, and then when it was already approved, dumating naman si Delta. So nagsara yung ospital. So walang makapasok kasi actually we have to expand our wards eh.
Yeah.
So there is a point na mas marami ang COVID patients namin sa non-COVID, and how could you do your interview, your survey sa medical records, hindi makakapasok yung tao, usually gwardiya lang nag-aabot, so how can you conduct? So that's why we have to cut short our study.
Correct.
Kasi so yun yung mga challenges na namin. Yung mga lockdowns kasi it will really lock you down and prevent you from doing what you really want to do.
Okay. Thanks Doc Alex. Last one? Doc Santos study is interesting. Very specific. Doc Maria Rosa, would you like
Hello.
Good
afternoon, everyone.
Ako dun sa project mo na talagang parang specific, no? Yung
kasi my understanding what it was a project. Of course, people they had a research project. Mine parang ang hirap i-serve parang project with peso equivalent. So, dinownline ko po yung study ko na safety and awareness of risk reduction protocols. Parang practical application po with that gadget. Yun lang po.
Okay. Is that already available?
Yes!
Okay.
Yes po. Let's plug Shopee and Lazada po. You can buy that gadget. Magpatingin ho.
Okay.
I've done it for many patients. Of course, it's not as good as the face-to-face, but it at least for simple cases, baka it might direct you towards a good diagnosis. Yun lang po.
Okay.
Yes.
Okay, thanks.
Thank you po. Stay safe, everyone.
Okay. Thank you. Okay. Salamat po, no? Salamat sa sharing. So we end our conversation with a happy note on the batch 1's presentation. So hopefully those that will have their next presentation, we have learned a lot, no, from batch 1 since yesterday across discipline, across programs. So we can't wait for their graduation earlier next year. So they will be preparing for that, and then hopefully the next batch will also prepare for their presentation. Now, for those who will be pursuing their thesis, we wish you all good luck from the faculty of the MM Collab Group. So there will be a Zoom meeting for those that will be pursuing their research for the master's degree. And then also those listening today, the PhD group, you will also have a Zoom meet, no, for your dissertation. So may schedule po yan. And hopefully, wala naman problema, hindi naman aalis ang PCU para sa graduation nyo. So ma-extend konti, no? Because merong proseso ang paggawa ng research. So ibig sabihin, if ang master's isang defense lang, no? But ang dissertation ng PhD natin, dalawa. No? So one that is for the title and the other one is for the final paper. So hopefully maka-accomplish tayo lahat, no, dun sa ating programa na pinili. Okay? So thank you so much. And there will be a certificate of recognition will be distributed. We will award a certificate of recognition to all those who presented their papers. Okay, so you will receive two. One that is on the attendance, and then the other one is for our token of appreciation for you. Really, I know that this is not, shall I say, this is not common to all the other groups of PCU, no? So parang yung ang MM Collab lang ang nag-initiate ng ganito. But the purpose of this is for our works to be acknowledged because this is public dissemination. And I have been sending to President Gawan yesterday's activity until today, until kaninang umaga. So nasa province siya, but he's saying thank you, congratulations, extend my congratulations. So alam niya kung ano yung ginagawa natin. So salamat po sa lahat, no? So lahat po magkakaroon ng certificate of recognition. I think from yesterday's presenters to the last presenter, we would like to extend our congratulations. Thank you po. Okay, and this officially ends our activity for
Congratulations.
Seminar paper presentation. So shall we have our photo op?
Congratulations sa lahat.
And congratulations. Okay.
We try to gawin yung abstract ng lahat.
Yeah, we promise, no? We promise to present to PCU our book of abstract.
Yes.
So sana talaga ma-print natin na maganda, no? And hopefully nandun yung mukha nyo na nakatoga, no? So we are planning for that, no? Na kaya inuunti-unti natin, no? Na
kulang na lang picture and bio sketch.
Yeah, something like that.
Bio sketch para pag may a little background of the
natin yung binding natin ng ating document.
Binding. Para okay.
So let's have 10 seconds of our smiles. Yung ngiting graduation.
Ngiting Chris.
Ang ngiting
Chris
mo. Alex, ha?
Okay. Sasakyan.
Tok Alex pala yan. Tok Alex. Hello.
Okay, 1, 2, 3. Gusto ko yung smile ni Doc Reyes. Okay, we have a second slide. Ayan.
Si Doc Emily.
Thanks for joining. Marami tayo, Doc Baikyong. Okay. Okay, this is the third slide. Okay. And then we have the fourth. Okay. So salamat lalo na dun sa mga first trimester na students, second trimester. So you're on your way to also writing your paper. So you will be the next. Okay? You will be the next. So thank you po. Maraming salamat po. Thank you.
Thank you po.
Thank you very much.
Salamat po.
Thank you po.
Thank you.
Congratulations.
Congratulations to all.
Yeah, congratulations.
Thank you. Thank you po.
Okay.
Sa lahat.
Bye.
Thanks, Ariel.